All right, so I know people are still filing in, but I don't want to delay this packed day that we have for all of our wonderful attendees. I'd like to welcome you to the New Jersey Healthy Kids Initiative's Lessons Learned, Future Opportunities Virtual Symposium. My name is Chris Gunning. I am the clinical nutritionist for Rutgers Student Health Services and the New Jersey Healthy Kids Initiative. I just want to do a few brief kind of housekeeping items for all of our attendees. So first, foremost, welcome. On social media, if you'd like to follow along with us, if you'd like to tweet, post, share items, our handle is at NJKidsHealth across all three of the major platforms, Twitter, Facebook, and Instagram. You can also use the hashtag NJHKI to tag your post, and we will be monitoring that throughout the day. So please feel free to put your questions in the Zoom chat. However, we're happy to engage with you via social media as well. In a moment, I'm going to introduce a few members of Rutgers leadership that are going to be providing some opening remarks to us. But just in terms of our speakers later in the day, there will be a question and answer session towards the end of each speaker's presentation. We're going to ask that if you have a question, please just type it into the Zoom chat. Members of our team will be monitoring the chat, and when it is time for the question and answer session, our team members will select a few questions to pose to our speakers to provide some answers for all of you. We will unfortunately not be able to get to all of the questions that are asked. However, we will do our best to cover as many as we can. With that, I'd like to begin by introducing our first two individuals that will be providing opening remarks for us. The first is Dr. Maria Gloria Dominguez-Bello. She is the director of the New Jersey Institute for Food, Nutrition, and Health. She's also a Henry Rutgers Professor of Microbiome and Health and a professor in the departments of Biochemistry and Biology, Microbiology and of Anthropology. Excuse me, little tongue twister there. Second, I would like to introduce Dr. Wendy S. Kohik. She is the Dean of Research and Graduate Education for Rutgers School of Environmental and Biological Sciences, as well as the Director of Research for the New Jersey Agricultural Experiment Station. So with that, I'm going to stop sharing my screen and pass it off to Gloria.
Good morning, everybody. Welcome participants and guest speakers. It's great to be here. This is the third year and the sixth symposium of the New Jersey Healthy Kids Initiative. And this time is special because we have with us the founder, PI of the project, and also my predecessor, the founder director of the IFNH, Peter Gillis, who had to get up very early this morning because he lives in Oregon. Welcome, Peter, especially. So this initiative is an intervention program to improve health across the state of New Jersey, improve health of kids, but also to open research opportunities. And it builds infrastructure and community partnership in ways that will remain in time, so the benefits will last. It was born in 2018 when I arrived at Rutgers, actually, with the support of the Robert Wood Johnson Foundation. And it's a joint project between the Child Health Institute of New Jersey and the Institute of Food, Nutrition, and Health, the IFNH. And this year, again, we have a great agenda with great speakers, so welcome everybody. And I let it to Wendy.
Good morning, everyone, and welcome. I'd like to build a little bit on Gloria's comments as the Dean of Research and say that the New Jersey Healthy Kids Initiative continues to build programs that spark research projects aligned with IFNH centers and programs. And even at this very early date, this has driven submission and publication of peer-reviewed manuscripts and funding of grant applications. The New Jersey Healthy Kids Initiative has hosted a series of 5 symposia before today, focusing on child health in the 21st century, nutrition and fitness education for lifelong health, big data and technology in child health, and systems approaches to child health and well-being. These symposia, including the one you are attending today, have brought together national thought leaders in childhood nutrition, physical activity, and health, with local community leaders on the ground throughout New Jersey to understand how cutting-edge approaches can be applied to our cities, towns, and communities. The New Jersey Healthy Kids Initiative has worked with schools and communities throughout New Jersey, providing engaging programs for students, community members, and professional development opportunities for teachers to improve culinary and physical literacy curriculum. The hallmark of the initiative is flexibility and partnership with each school and community in the development, enrichment, and adaptation of their existing programs to become more effective and to offer new tools for evaluation and research of program effectiveness. The flexibility of the New Jersey Healthy Kids Initiative was highlighted during the COVID pandemic when educators pivoted towards novel online approaches and then rigorously evaluated their value, as you will hear about today. And with that, I join you in looking forward to a very exciting symposium. Thank you.
Thank you, Dr. Cohen. Oh, I'm sorry. Go ahead, Arnold.
Absolutely. I'm Arnold Rabson, Director of the Child Health Institute and co-principal investigator of the New Jersey Healthy Kids Initiative. And first, I'd like to thank Dr. Dominguez-Bello and Dr. Kohik for their kind words and really kind introduction. I'd also very briefly like to thank all of you for joining us today for this exciting day, and especially thank the NJHKI team for putting the day together, particularly heroic work from Chris Gunning, who put this day together so beautifully. Our first speaker is Dr. Ann Barnhill. Dr. Barnhill's no stranger to us. She's joined us for these previous symposia and also as an advisor for the Institute for Food, Nutrition, and Health. And Dr. Barnhill is a core faculty at the Berman Institute of Bioethics at Johns Hopkins University and a research scholar in the Global Food Ethics and Policy Program at the Berman Institute. I won't go into the details of her wonderful, extensive biography, which is present in the program. But suffice it to say that her talks that I've heard, and I've been a couple now, have always been beautifully presented and really challenging to us in terms of looking forward. So it's a real pleasure to have you back, Dr. Barnhill, and to hear you today. Thank you for joining us.
Good morning, everyone. My name is Sarah Elnikib, and I am a research associate with the New Jersey Healthy Kids Initiative and a assistant professor educator at the Family and Community Health Sciences Department at Rutgers Cooperative Extension. And it gives me great pleasure to introduce Dr. Pamela Cook, who is the Mary Schwartz Rose Associate Professor of Nutrition Education at Columbia University's Teachers College. She was the executive director of the Lauren M. Tisch Center for Food Education and Policy for a very long time, and the past president of the Society for Nutrition Education and Behavior, where I had the pleasure of working with her closely. And she's also a New Jersey Healthy Kids Initiative Scientific Advisory Board member and a Rutgers alum. So we are very, very happy to have Dr. Cook with us today to speak about nutrition education, why it's needed, what it is, and how do we expand it. So Dr. Cook.
Thank you so much, Sarah, and thank you for that introduction, and thank you for having me here today. Everyone can hear me fine, right? I want to just show, because I happen to have it right here in my office. I actually was hired as what's called the Nutrition Education Assistant at Rutgers in 1985, and this is the letter of the offer letter, and that launched my career. So it is an honor that I am here today to talk to you about nutrition education. I just had a few very, very quick comments for our amazing first talk. So thank you for Ann Barnhill, Dr. Ann Barnhill, for that talk. One is, I think part of that tension of the differences is we have this sense of progress in our country, I just literally right before this, from 8 to 9 this morning, recorded a lecture for one of my classes that's called Nutritional Ecology that I teach with Joan Gassel, who I mentioned in my talk. And the session was on true cost of food. And one of the articles that was actually in Harper's Magazine in 2016 is called The Trouble with Iowa. And one of the topics is the waterways in Des Moines, Iowa being polluted by industrial agriculture, and the people fighting to change that were called radicals. So just think about that. If you're the public health person trying to fight against water pollution, safe water for all, just like the right for health, we should have the right for water. And we know that we haven't had that in our country. And they're considered the radicals because it's progress to do whatever needs to be done for industrial agriculture. The second is, and I think this relates to, and we've been talking about this a lot in our course, is individualism and the role that individualism plays in our society. I'll just give a really quick example. After we had that discussion, one of my students found a survey around the world on individualism, and the top was 100. The United States scored 91. Singapore happened to score 20. I was on this week on a talk with a graduate of mine from Singapore, and he said, you will never see anyone anywhere besides in their own home without a mask in Singapore right now. And it's just a difference and I think individualism has it. The other is I love the right to health. And we've been talking about that too, and talking about the structural racism. And basically, what if we had reparations for the right to health for all those people over generations that have been denied the right to health? If we could actually have reparations for that, which would mean advancing the right to health now to where it should have been if they always had it. Just think what we could do as a country. And I know that there is all these devices. Okay, I'm going to try to share. And Chris, I know you have my slides if that is not successful. So let's see. Let me do play from start. Can you see my slides? Yes.
Yes,
okay.
we can.
Okay, great. And you're seeing just the slide, not the next one, right? So you're seeing the right thing?
Correct.
Okay. Great. All right. So as Sarah introduced, I'm Pam Cook. I'm going to talk about nutrition education. Again, I started my career in nutrition education at Rutgers, why it's needed, what it is, and how to expand. So to begin with why it's needed, and actually, Dr. Barnhill, you described this all so well. It is needed because we have a food supply that is not promoting us being healthy. It's not promoting social justice. It is not promoting ecological sustainability, and it's affecting our health. This is a really old ad, sorry. 11 billion is spent yearly advertising convenience food, snacks, and alcoholic beverages, as you can see, and the little person there with giving out papers saying, we're too fat, read all about it. A very small message that gets out there. We also have landscapes like what you see here with fast food. That is, we have a plethora of foods like that that are around us. There's been many calls to change this. One was from the Rockefeller Foundation. This was a report that came out just over a year ago in July of 2020. And it basically is about our food system is at the limits. It's actually came out after the Lancet report that was just talked about. And so this shows that we're stretched the system. And so I think this is really interesting. It says the food system in this country is in many ways a marvel. Designed to address widespread malnutrition in the wake of the Great Depression, it met the needs of a desperate nation. Now, I want to say, I'm not quite sure that's true. There were hungry people during the Depression, but there was also a lot of food that was just being destroyed because it was about poverty, just like people not eating today is about poverty. Next, and you can see here, and by the way, I love having the quotes on the slides, especially on Zoom, so don't apologize for it, Dr. Barnhill, and I have that too on a lot of my slides. So, and yet, the food system evolution also had consequences. The Green Revolution, which the Rockefeller Foundation played a role in seeding and scaling, was effective and successful in addressing calorie-based hunger and averting mass starvation. We could argue whether or not that's true, but it left a legacy that we see clearly today, including overemphasis of staple grains at the expense of more nutrient-rich food, reliance on chemical fertilizers that deplete the soil, and overuse of water. So this is a system that is not treating the people that work in it well, is having ecological damage, and is decreasing our public health. This is why we need nutrition education. And it results in grocery stores that basically look like this. If you've read the literature, 60% of the foods in the US grocery store are ultra processed foods. Those are because we are growing a lot of corn and soy. By the way, when I was at Rutgers was when Mike Ham was there just starting to grow the organic farm that I think is still on the Rutgers campus today. And so hopefully that is part of the solution and part of not creating the system that does this. And then this makes it that we actually have to try to say, what can we do to change this food supply? The policies that would have to be put in place to radically change this food supply would reach a lot of challenges. And so the photo I'm about to show was just yesterday. We had a rally in New York City. Unfortunately, I couldn't go, but this is some of my students and some of my colleagues here. And this is for a bill that's up right now in New York City, introduced by Mark Levine, who is in charge of the Committee on Health for the New York City Council. And it's basically if a single item served in a fast food restaurant has more sugar than is what is recommended to have in a day, and that's out of 50 grams, 12 teaspoons, basically 10% of a 2,000 a day calorie, it has to have a warning label. That's a pretty low bar, right? All of the added sugar you should have in a day. So hopefully this bill will pass in New York City and hopefully other people will follow. Now I mentioned Joan Gussow, who I teach with, and I want to read a quote that she wrote in 1980, which is, teaching food and nutrition might be viewed as the single most important educational activity of a society. If persons do not learn to obtain and consume food so as to sustain themselves and their dependents, all other learning is irrelevant. So we need to learn about food and nutrition. We need to understand the system that produces food. We need to understand how workers working in the food system are treated. And that is important for our health and for the health of our planet. I'm going to show a photo of Joan. This is actually Joan in Piermont, New York, where she lives. And it is, she actually has grown most of her own food. One of the most important lessons I've learned from Joan is that we need to teach people about food because people need to understand our food system to be able to make choices about what they want to do. I think that that would help that tension that we were just talking about before, if people really understood the system. So that is why nutrition education is needed. I just want to tell you too, that board, this photo is about 15 years old. Joan is 93 now, still growing a lot of her own food, but that boardwalk was destroyed in Sandy and she had to change her whole yard for future floods. And actually her garden isn't doing well because the water table of the Hudson River is rising with climate change. So that just shows the reality. So I am indebted to Joan for what she has taught me. And she actually was two people before me in the Mary Schwartz Rose professor position. So now I'm going to move to the second topic, which is, what is nutrition education? I've also been very fortunate to work with Dr. Isabel Contento, who was actually the second Mary Schwartz Rose professor, and I have followed her, and also very involved in the Society for Nutrition Education and Behavior. And she's written a textbook called Nutrition Education, Linking Research, Theory, and Practice. This is the 4th edition, and I am now a co-author with her on this book. And this book basically defines what is nutrition education. Stop and think about it for a second. Nutrition education is a different topic than teaching about anything else because we all have such deep experiences with food. So it is very interdisciplinary. So basically we need food and nutrition science to help us to understand what messages we need to get out to people. That is also food system science. Social science is about understanding everything about the food system, as well as basic nutrition science. And then we need psychology, because psychology, when it's in a cultural context, can help us to figure out how do we motivate people, get them interested in it, and how do we actually facilitate them feeling confident to and wanting to, which is the motivation, make behavior change. And then we need the field of education. The field of education is, how do you tell a story? How do you create a lesson that actually flows, that people feel like They get the arc of the story. They want to do something different. And then finally, it's about communication. How do we deliver something in a way that truly impacts people? So that is the field of nutrition education, this combination of food, nutrition, science, psychology, education, and communication. We also need to think about all of the different things that influence why people eat what they eat. So this is actually something that Dr. Isabel Contento is very well known for. And it is basically a little bit like this, the social ecological model that some of you may be familiar with. But we have what's in our bodies, what are our biologically determined predispositions to food? And we basically have a sense of hunger and fullness, although our highly palatable food ends up making that system not work as well. We have some basic tastes, and we have what's called sensory specific satiety, which is that we get tired of eating foods. Then we have all of our experiences with food, and then we have our person-related determinants. So those are all the things in us, our attitudes, perceptions, and then we have the people around us, our family networks, and then we have our social environment around us. All of this is what influences why we eat what we eat. Now, very often people think that there's only one thing we need to do in nutrition education, and that's teach knowledge and skills. And when you see that knowledge and skills is one little tiny piece of why people eat what they eat in this whole sea of reasons, it helps you to see why we need to have nutrition education be this dynamic complex, looking at everything that is going on with food. So to say this in a different way, we have influences, biological, sociological, person-related, environmental. Those can be called determinants, and those predict our eating behavior. Now I want to show you a definition of nutrition education. It's education that inspires and builds confidence for students to make food choices that support personal health, ecological sustainability, social justice, now and in the future. And I just want to highlight a couple of words really quickly because I don't want to run out of time. So education is more than just giving people information. It is going through everything that I just said that makes it complex and brings people in so that they can remember what they learned and want to apply it to their lives. That's inspiring them, builds their confidence to make food choices. We can't coerce anyone to do anything with our words. All we can do is help to facilitate that change and do it in a way that brings it along. Then we do that for these really big goals of people being healthy. That's our public health, ecological sustainability, and social justice. And we want them to do that now. We would hope that anytime we teach children about food, they are thinking about it the very next time they eat and thinking about their food choices and thinking about what they learned. And it also sticks enough that they are doing it in the future. So now I want to go over basically what is nutrition education? How do we frame it? The first thing is we have to have what's called a behavior change goal. And that is what action we want people to take. Then we have to motivate them, facilitate change, and create a supportive environment. I want to do a quick example of how you put this into action. So for a behavior change goal, we have a program that was funded by the USDA called Food, Health, and Choices that was working with fifth graders. And we had all of these goals: choose more fruits and vegetables, physical activity, and choose less. For this example, I'm going to focus on one, which is sugar sweetened beverages. So what did we do to enhance motivation for why to take action? One of the things we did is showed how much sugar is in drinks. And this is over 16 teaspoons of sugar. I just said before that what is recommended to have in a day is 12 teaspoons of sugar. Do you know when this 20-ounce bottle was first introduced? 1993. Maybe some of us were already grown-ups by that point in time, but for children, that means this is what they've known as the average size when it's more than what we have in a day. And when it's framed that way, it's not about guilt that I made a wrong choice. It's what are we doing in our food supply? Then we can also show the ecological impact. 1 million bottles a minute. That's how many plastic bottles we make. And we don't know what to do with them. They're ending up in our oceans. They're ending up everywhere. And so what can we do? We can facilitate action And this is actually a picture of a water bottle that was given to my son, now in college. When he was in high school, every kid in the school got this to bring water. So they learned why not to have sugar sweetened beverages for their health and for the environment. And then this became the norm in the school. And they made sure that they had really good fountains for the kids to fill up their water with cold water during school. So when we take that all together, what is the action? Motivate, facilitate, and create a supportive environment. I want to tell you that this is not new. This is actually Mary Schwartz Rose that I've mentioned before. In 1922, she wrote this book called Food Lessons for Nutrition Classes. I can't believe it'll be 100 years old next year. In this, she says, the interest aroused must be intense enough to carry over into the home environment. There must be intimate personal contact with each child in order to gain his confidence and inspire him, and I know it should be him or her, with a sense of responsibility for his own health. There must be knowledge of the home situation to help make it favorable to the program with which the child is being asked to carry out. So that's creating the supportive environment. So Mary Schwartz Rose, and she's here measuring children basically at that point in time to make sure that they were growing enough a century ago. But you can see the same messages. This is also a book that came out from Teachers College in 1959. And it's all about why we should do nutrition education. And it says, the sensitive teacher helps children explore questions. One third grade class, their study of food began when a pupil asked, where does our food come from? They ended up having a grocer that was a father in the store come in. What I love about this book is the very last page. It says all about how it was just inklings of an overabundance of food and how that would affect us. And what they said is, when should we start making these changes and making sure all children are getting food and nutrition education? And the last three words are, today is not too soon. So even though this is many decades later, today is still not too soon for us to start this education. So now I want to bring it to the present. We do a lot of research on food and nutrition education organizations that work in New York City schools, bringing in all these kinds of experiences, just like I've just been describing, getting kids gardening and cooking and talking about food justice and ecological sustainability. And so we did a report in 2018 called A is for Apple, the State of Nutrition Education Programs in New York City Public Schools. And what we found, there's a lot of schools in New York City, is that 55, almost 56% had at least one of these programs in their school. You can see some of them had many, many programs in their school, which is great. But 44%, and that's 815 schools, didn't have any of these programs. We had done an earlier study, which was just, and if you know New York City, it has 5 boroughs, just in 3 boroughs and just in elementary schools. And this report, the more details showed that elementary schools had more of these programs than middle and high schools. And so what we found in 2011-12 was that 39% of schools had these programs. So overall, it was higher in 2016-17. When we looked at, from the data that I just showed, only those 3 boroughs and only elementary schools, it was 71% of schools had this program. That's a big increase. Now, you may be looking at this and you may be astute to notice we are now in the 2021-22 school year. And so we want to do this again to figure out what is going on now. Unfortunately, with the COVID-19 pandemic, we have had a lot of these programs go under, not be able to exist anymore. Some of them have been able to change. So it will be even more important to track, are children getting these food and nutrition education experiences? We have created what's called the Food Ed Hub. And this is actually funded by New York City Council, and it's to basically elevate food and nutrition education. So it's really doing the same thing in New York City like you are doing in New Jersey. And we have this is 4 tabs that are on this site. I want to highlight 2 of them. First is the e-learning hub. That is what we created for all of the groups that basically put their food and nutrition education online, to have a platform for all of that to be shared. And then second, this is a food ed finder to find all of the different programs. This actually has not been updated since 2018 when we did that report, but we are updating it now and including all different wellness programs. So it will be a resource for New York City schools. Okay, I want to make sure oops, we're over on time already, aren't we? Yeah.
You have a few more minutes.
Okay, so I'm going to go through really quickly how to expand. So how can we expand food and nutrition education? This is going to be, what do we need to focus on? What do we need to do to make this happen? And it's to get the message out there. The first is to focus on reducing ultra processed foods. This is the ingredient list for this Hungry Man dinner. When you look at that ingredient list, it's crazy what goes into there. And you might want to notice, if you can see it, you might not be able to see it on your screen, but part 4, which is the vegetables, is just corn, carrots, corn, and cut green beans. But the rest of this is for these products here, which is crazy. And this is the photo that I showed before. We need to focus on this. The 2020 Dietary Guidelines for Americans actually doesn't talk about, it talks about processing of dairy and soy products. It doesn't talk about processed foods. We need to make sure that is talked about and is with the public as well as with policymakers. The second is we need to make equity central. I am part of the nutrition profession. It is an 85% white women profession. We need to diversify our profession, and we need to be talking about all of the issues of systemic racism like we've been talking about so far here today. This is just an article from The Guardian about food apartheid and what we would do if we actually took that seriously. And I just love this image. The next is something called, we need to navigate and advocate. So navigating is teaching people how to navigate through our really challenging food supply that we have now with the education that we do, as well as then advocating for change to the system. Fourth is we need to enjoy and celebrate food. If we were all together, I know we would be having amazing food at Rutgers. And that is part of what we need to be doing all the time, and with children. I do a lot with school meals, and how do we make school meals scratch cooked, unprocessed foods, of course, meeting all of the USDA guidelines, and that school lunch is an enjoyable and central part of the school day. And then finally, to do what we're doing here today, and that is to make sure that all children everywhere throughout their schooling are getting experiences with real food, gardening, cooking, learning about nutrition, learning about food justice, learning about how the way we produce food affects climate change, because that will make today's children tomorrow's adults that can face the difficult challenges that we have ahead. So hopefully we will have more nutrition education for a better future. Thank you.
Thank you
Thank
so
you, Dr.
much.
Cook. Go ahead, Sarah.
It was excellent. Yeah, no, thank you so much. I think that was a great overview of nutrition education and its place in the larger ecosystem and kind of all of the different aspects we need to consider when we're doing nutrition education. So we do have one question from Yvonne. It's more of a comment about the role of dental health when it comes to nutrition and how integrated oral health needs to be in nutrition education and nutrition education in oral dental settings.
I thank you for that comment. I fully agree. I've actually done a project called My Smile Buddy with the Columbia School of Dental Medicine for many years, and we're actually about to embark on a survey with pediatric dentists to say, would they bring more behavioral nutrition into dental practices, because they are so intricately tied, and severe dental caries affects many children, the same children that are affected by so many other systemic racism issues that affect their health. So thank you.
And if anyone else has any questions or comments, please put them in the chat or the Q&A box and we'll ask Dr. Cook. Chris, how many more minutes do we have for questions and answers?
We have 5 minutes. So if any of our attendees would like to raise their hand and you don't feel like typing it, I can unmute you and allow you to speak, or you can type it in the chat, or if any of our other speakers or panelists would like to talk or ask a question. Looks like Dr. Hoffman has one.
Yep. So my question is, dealing with schools in New Jersey can be a challenge. And how important do you think it is that we reach as many schools as possible, or should we focus on those that we believe are most at risk for some of these problems?
So that is a really good question. I would say focus first on those that are at risk. What we have found in New York City, which is a little bit different because almost all the schools are truthfully, there's very few schools that don't have a lot of students at risk in New York City. What we have found is that a lot of programs will end up going to the same schools because the principal is receptive, yet the children at all schools need it. And so what we are trying to do is now say, how do we reach out to the schools that may not be as receptive and the students need this, and making sure we are reaching those schools as well. And I think one way to do that is nutrition in terms of the curriculum, where it quote unquote squarely fits in education, is a topic in health education that has many, many important topics. And many of the programs are connecting it to science, to social studies, to art, to connecting with physical education. So, there are many, many ways that it can actually be seamlessly incorporated and actually give applications. Like cooking is a great application of math. And so what we have found is when we can connect it to all of the different academic subjects and make it really fun applications for those subjects, it brings it more into schools.
Yeah, that's really great advice. And we have a question from Arnold about, with peer influence being so critical, particularly in high school, what kind of work is being done in this area?
Yeah, that is a great question. One of the things that I skimmed over really, really quickly is there's many more programs working in elementary schools than high schools. And I think high schools, and maybe to back up, is we did a very large program with middle schoolers that actually changed their behavior and what the middle schoolers told us. And in New York City, I will say, because it's a walking culture more than a car culture, kids, and I grew up in New Jersey, raised kids in New York City. They get independence a lot earlier in life. And so they start making food choices with their friends. And of course, they're buying what's available out on the street. It was because of those middle schoolers telling us they wish they had learned it younger that we did that program called Food, Health, and Choices that I mentioned, because we wanted fifth graders to be able to be thinking deeply about these issues before they moved into middle school and got a lot more freedom to make their own choices. There are many programs that, and we need more, that are actually really looking at food and nutrition, not through a lens of you better make this choice or this is going to be bad for you, but through the lens of social justice and equity and learning about the food system, because that's actually can really connect with youth. And I think the question was about peers, and it can make it so that it becomes the normal change that they want to make.
So we have a couple minutes remaining before we're going to go into our first short little break, but we have two questions that did come in. Both Peggy raised her hand, and then there's a question in the chat that I'll let Sarah read.
Yeah, so Peggy, why don't you go, and then I'll ask the question in the chat.
Great, thank you. Pam, wonderful presentation as always. Great to see you. We have a challenge in how to work with school food service. We're teaching nutrition education in the classroom, and then it's not being modeled in the lunchroom. So how do you suggest that we go about this? There's a lot of school food service companies that are there, some are self-op, and they're not willing to change. They're all about the bottom line. So what suggestions do you have to face this challenge?
That is a huge challenge, and New York City is self-op and one, for public schools, one big operation. I think that what you'd have to do is highlight the places, and there's many places around the world, first of all, that are doing amazing things with school lunch, and there's many places in this country that are really pushing the envelope. And the more that we can say, we demand more, and we want what is in school meals to be a good model of what we are doing in food and nutrition education. I frankly had a lot of people that are doing the programs that I've been talking about saying, I don't tell the kids to eat school lunch because it's not it doesn't look the way I want a meal to look. And that is a big challenge. New York City did a pilot 18-19 school year, so the full school year before the pandemic, that they did full scratch cooking in just 2 kitchens out of 1,000. So it was huge. It was a drop in the bucket, but it was a huge pilot in that they actually were able to do full scratch cooking for that year. That got the attention of all of the policymakers that push school food. And we do menu analyses of all of the New York City menus. And basically, if you look at the menu this year, there are things on it like chicken teriyaki with vegetable fried rice, which hadn't been something that had been on there, or even stuffed shells, which was like mozzarella sticks, I think is what they replaced. So, you know, stuffed shells are at least more of like a meal kind of thing. And vegetable dumplings and I actually think they're chicken dumplings, you know, so there's all different foods that they are now introducing that feel more like a meal. And I don't know if I'm going to get it, but I have a grant in to do something called Crunch Lunch, which is creating resources, uplifting nutrition, culture, and health at lunch. And it's to work with schools to make school lunch a central part of the school day that's celebrated, important, and everybody gets involved in. Maybe the silver lining is what COVID did is elevated the importance of school meals, and there was the grab and go meals around the country, and principals have had to pay more attention to school food this year because that's where kids have to take off their masks in order to eat. And so I think a lot of principals that just let school food go, it just happens in the cafeteria, I just have to keep the kids safe, whatever, if they eat, they don't, have now had to think about it. And I hope that will, with elevating all of the great work that's being done in other places around the country, will help to push us forward.
That's wonderful. Thank you so much, Pam. And Dan, if it's okay, I'm going to ask the one question that's in the chat box first. There's a question that's asking about social media effect. How do we get social media to effectively facilitate, help foster nutrition education and cooking at home with parents and children?
So I think it's just like everything with social, I don't know, maybe I'm answering it too simply, but I think we have to get out the really, really great messages. We know that all children, and maybe it's affecting girls a little bit more than boys, I'm not sure. I have sons that are older and a lot of young nieces, and social media is going to have a big impact, I'm scared, on their body image and who they are. And so the more that we can get out positive messages, the more that we can get out really good messages about good food and cooking and celebrating eating together and celebrating listening to your body and what your body needs, I think the better off we can be. And that's a challenge because that's not a lot of what's out on social media right now.
So I'm going to actually jump in here just because I want to try and keep us on schedule for today, because we do have several panel discussions and speakers remaining. I know some additional questions are coming in the chat. We really do appreciate it. I'm sure Dr. Cook will be able to see those questions and she may be able to respond directly to you or post her responses in the chat. However, we're going to thank Dr. Cook for a fantastic presentation. Thank you so much for joining us. And we're going to take a short, about 6-minute or so break right now to allow you all to kind of get up, stretch, check some email if you need to, use the restroom, whatever you need to do. And then we'll promptly return at 10:20 a.m. with our first panel discussion.
Thank you for having me, and you are welcome.
Thank you, Dr. Cook. It was awesome.
All right, welcome back, everyone. Hopefully you had a chance to get up and stretch and move around, check some emails, do whatever you needed to do. We know it's a lengthy day, and we appreciate you joining us for the duration of today. And we want to make sure that we're not just sitting all day long. We're talking a lot about nutrition and health, and we know how important it is to get up and move around a little bit. So I'm delighted to introduce our 4 panelists that are going to be joining us for our first panel discussion of the day. We have another panel discussion with a great set of panelists later this afternoon. We hope you all stick around for that as well. But I'm going to just provide some very brief introductions. I'm not going to go through every panelist's lengthy CV and fantastic work that they do. We've put all of that in the program booklet that we've sent to all of you. I will also post it again in the chat so you can access it. So if you'd like more detailed information about all of our panelists, please refer to that. However, I would like to introduce first Dr. Manny Jimenez. Dr. Jimenez is an assistant professor of pediatrics and family medicine and community health. He's also the Director of Developmental and Behavioral Pediatrics Education at the Boggs Center on Developmental Disabilities at Rutgers Robert Wood Johnson Medical School. Our second panelist, Lilia Fabila Gulbat, is the Family Coordinator at Greater Brunswick Charter School. We've done a lot of work with Greater Brunswick Charter School over the past several years, so we're very excited to have you with us, Lilia. Next, we have Dr. Darren Anderson. Dr. Darren Anderson is the Chief Executive Officer for the New Jersey YMCA State Alliance. For those of you that may have attended last year, Dr. Anderson gave a fantastic presentation last year, and we're excited to have him return again this year. And last but certainly not least, we have Dr. Kara Cute, and she is an Assistant Extension Specialist and Assistant Professor in the Department of Human Ecology here at Rutgers University. So thank you all for joining us and being a part of this lovely panel discussion. So we're gonna, kind of just kick things off by, I'm gonna pose a question to you, and then whoever would like to chime in, please feel free to do so. And if you'd like to, any of the additional panelists would like to add on to it, please do. So from a community engaged perspective of child health and or nutrition, what has worked for your communities, and what do you feel are the barriers that remain?
Hi, good morning, everyone. My name is Lilia Favila. Can you hear me?
Yes, we can.
Okay, perfect. Thank you. So my name is Lilia Favila Gilpon. As you mentioned before, I am the family coordinator. We have at Greater Brunswick Charter School. We have been very lucky to work with Rutgers University and the New Jersey Healthy Kids Initiative in 3 different programs. So we started this conversation about partnering with you since 2018. So finally, this dream of working with you come to realize on 2019. So that's the first time that we sent our students to your facilities, to the Center for Health and Human Performance, to have their physical education classes. So they were our 8th grade students were part of the Athlete Mentor Program. I think it was called Long-Term Athletic Development Program, but for short, we call it as the Athlete Mentor Program. Then the following year, we were also part of the Cultural Health Program, where our kindergarten students and our 7th grade students also participated in the same type of program. And recently, during the pandemic, we were part of the culinary lessons and cooking demos with our provided to our 4th and 5th grade classes. Also, as part of the Rutgers programs, we have worked with Dr. Manny Jimenez with the Ready and Healthy for Kindergarten program. We just finished our 2nd summer program with them and the Robert Wood Johnson School of Medicine. So we have been very, very fortunate to have these collaborations with you. So what has worked for us? Well, our students always came back with good, positive comments. It worked for us. It has worked for us, GBCS, to always look for collaborations and partnerships with institutions in the communities, just like you. So our students really, really benefited from the program. They really like it. We were able to provide, to help the students work on their gross motor skill in a small group, something that we don't have the chance because our physical educator teachers, they usually work with 44 students. So this time when our students were coming to your facilities, they got the chance to work in a small group. So they were working with one athlete, probably a group of 6, 7 students. So that was very, very beneficial. It also helped them, our students, to set their own personal skills. They were so motivated about the training, the work that they were doing, that they came home and they set personal goals for them. I remember one specific student one specific case of a student who was so motivated for the program on the first year that she lost 10 pounds, just practicing what she learned during those classes and physical ed classes. Another student also, he was never interested in sports, but he got so motivated, after talking and hanging out with the athletes, with the student athletes from Rutgers, that for the first time he thought about joining a sports club in high school. Our kindergarten also benefit from it. They look up to the students, so it was very, very beneficial. So that working with different agencies has helped us a lot. Not only with Rutgers, we also have worked with New Jersey SNAP educators. So they provide cooking classes and to our students, for parents and for students. They also brought the Just Say Yes to fruits and vegetables. As Dr. Pamela Koch was saying, we also need to educate parents and students, and we always try to make health and cooking and nutrition classes part of our curriculum. So it has always been part of our curriculum. So we always try to do that. We also incorporate gardening classes into our curriculum. So the students in lower grades, kinder, first and second grade, they have gardening classes as part of their clusters. And we have, this summer we have grapes. So they were all benefiting from collecting grapes from that. So they have work for us. The barriers remain, like, access to technology, access to this wonderful program, like we don't have transportation. So that's kind of the barrier. For the cooking classes, sometimes the parents have to be present while the students were cooking. So that's one barrier, that sometimes we don't have the collaboration with the parents. And also for the students, we see that they have limited spaces to practice what they learn. Most of our students share living spaces at home. So that's the barrier. Thank you. But that has worked, and those are the barriers. Thank you.
Thank you, Lilia. Dr. Anderson or Dr. Cute or Dr. Jimenez, would any of you like to add to that?
Yeah, Chris, I can jump in, and once again, thanks for the invitation. I can say a couple of things that I think that we're kind of back at ground zero. I know that we've worked extremely hard, and we petitioned the USDA about ensuring that foods that are offered in schools, foods that are part of the SFSF program, the CACFP program, are healthy and nutritious. But I will tell you what's happening at the community level is that we're just trying to get food to children. I know that COVID has been an extreme disruptor, but we had families that went from upper middle class to lower middle class, and families from lower middle class that went right into poverty. And in fact, the YMCAs at our 31 locations, we have distributed over 2 million meals and provided food access. And many of those that would come to volunteer to help the Ys found themselves in line getting food. So the challenge is that we want to make sure that children are getting healthy food. We want to make sure children are getting the nutrition that they need, especially during this development part of their lives. But right now, we're just working with state government. We're working with the federal government. We're working with community food banks up in the North Jersey and South Jersey, just to make sure that we can get food to children. The Mickey Vento children that are part of school districts, they were somewhat left out. These are children that attend school in a particular school district, but they may live outside of the school district. They could be in a shelter. They could be in a transitional home. They could be living in a hotel. Well, many of these children may have parents that are undocumented. So they were not participating in the grab and go lunches that the school districts were providing. They were at home just simply missing out. We got wind of this. We did a quick research, and we estimated anywhere between 9,000 to 15,000 children across the state was missing out on these meals. So what we did was we tapped into our YMCAs, touched base with state government. We were able to get these grab and go meals and put them in vans and deliver them to the hotels. Why? Because they had trust with the YMCA. If anyone showed up saying, hey, we have food for you, we have meals, parents were not coming out. And in fact, we had parents, and in fact, we started inviting, as part of the New Jersey Action Coalition, nurses to ride with us, because parents had symptoms of COVID, but they were scared to death to come out to get tested. And now they're inside of a home with maybe 3 generations with their children. And now COVID is just infesting that entire family. So this is a broader issue. We need to make sure that child nutrition is vitally important. But right now we need to make sure that we can get children food that they need and provide those wraparound services to ensure that the families are safe and they can be on a pathway back to reclaiming their health.
Great. Well, I will jump in here from a slightly different perspective. I am a community engaged researcher here at Rutgers, and I work predominantly with college students experiencing food insecurity. And one of the things that I just wanted to mention that has been really important for us here at Rutgers is partnering with the community. And I was working on a research project looking at doing interviews with food pantries in the city of New Brunswick back in 2016. And they raised the issue to us about college students experiencing food insecurity. So it was really sort of a flip side where we thought we were studying the community, which didn't include Rutgers students. And it turns out that they were alerting us to a problem with our own students, although folks in student affairs were hearing it at the same time. But it was really interesting to me that the importance of listening and understanding that our community partners know things that sometimes we don't know, and that exchange of information. So in terms of addressing food insecurity with college students here at Rutgers, we have found that what really works is thinking sort of beyond just having a food pantry. Many college campuses across the country have food pantries, hundreds and hundreds of them. But what we've been able to do here at Rutgers, and other schools are doing it too, is providing fresh produce through our student farm. And this was an outgrowth of the farm started by Mike Ham that Dr. Koch mentioned earlier, working with the New Brunswick Community Farmers Market to provide vouchers for fresh produce, providing produce gift cards that Peggy Policascio has been working on through the New Jersey Healthy Kids Initiative. We've been able to provide meal plan scholarships. So getting healthy food to students, not just some of those ultra processed foods that are common in food pantries. And we know that many of our students who are experiencing food insecurity might not have time to cook. They are more likely to be working jobs. They don't necessarily have access to a kitchen, and they don't necessarily have that education and that basis in cooking healthy foods that we've been talking about all morning. So those meal plan scholarships can help make sure that we're getting healthy food. And then also situating food insecurity among college students as a health issue. So we've been working with Rutgers Student Health. Chris Gunning was a part of setting up this project, doing a screen and intervene, so screening for food insecurity when students come into student health, and then educating our healthcare providers about the resources on campus and having the healthcare providers talk to students about food insecurity as a health issue. And we did interviews with the healthcare providers at Rutgers, and they were really appreciative that we were raising this as a student health issue and as something that they now felt empowered to talk about with students as part of their conversation about their overall health. And then also just learning how, and this is something we're still learning, to more directly involve students in the work. So having our students help, whether they're experiencing food insecurity or not, but involving them in coming up with solutions, doing advocacy around these issues, and really engaging them in the work. And then in terms of barriers that we've had, I would say initially this work started really for us at Rutgers in 2016, when the idea that our students were experiencing food insecurity was raised. There was a lot of I don't want to say pushback, but some of the administrators at the school had a really hard time thinking, well, what is Rutgers doing something wrong? Is this going to make us look bad? But as we realized that this is a national issue, they really embraced the fact, okay, this is something that's not just here. And we have new leadership now that has fully embraced this the need to address this. But that was initially a little bit of a barrier within our students. I would say that there's a barrier where we hear over and over again from students experiencing food insecurity that, well, there are other students who need it more than I do, right? There are other students who need help more than I do. I'm not going to go to the pantry because if I use the pantry, well, then there's another student who's not having the opportunity to use the pantry, and they need it more than I do. And we're hearing this from among our students who are experiencing the most extreme levels of food insecurity. There's a real hesitance to ask for help, to see themselves as needing help. And then there's also stigma associated with using the food pantry. Is someone on campus going to see them using it? Are there students working at the pantry who might see them? And so all of that has been an issue that we're trying to address. And then finally, one of the biggest barriers has been sort of policies that can address food insecurity among college students at the national level. You know, the National School Lunch Program, free and reduced price lunches end when students graduate high school, but the need doesn't necessarily end. So how can we look at expanding programs like that into colleges, especially into community colleges? And then also college student eligibility for SNAP has been a huge policy issue where college students, it's very hard for them to be eligible. They have really high work requirements that are very hard for full-time students certainly to be able to meet, although that changed during COVID. So that was exciting, but definitely the policy arena has been a big barrier.
So I think I'm going to end up echoing a lot of the comments that have already been made. I mean, I think when our programs have had, the most success has been really when we've had the opportunity to go directly to parents and directly to community members to be able to understand their needs and to be able to sort of to co-develop programs in order to support them. As a community engaged researcher, much of our work sort of focuses on leveraging healthcare settings and sort of going beyond the healthcare setting to kind of help promote school readiness for children. And so, yeah, I think one of the largest barriers from our perspective has been kind of the rapidly evolving situation, especially within the context of the pandemic. And so, where like strategies such as online, approaches were kind of working for us very early on. We've had to sort of kind of pivot and sort of think about how we're doing this as like sort of like Zoom fatigue has kind of set in for a lot of families, and how sort of the the methods we were using are sort of not as enticing as they were previously. And so and then again, like kind of ensuring that sort of the programmatically we're able to kind of adapt in the context of how things are evolving. And so for example, with one of the programs that I'm very active on, the Reach on Read program, there's been sort of real sort of difficulties in terms of implementing the core model of distributing a book to children, having the pediatrician or pediatric professional provide guidance on shared reading. One of the key things that can really facilitate a model is having volunteers in the waiting room who are able to read with kids, or are able to sort of model for families. And so adjusting to sort of the infection control protocols and ensuring that we maintain safe environments while still trying to do the best we can for families has certainly been something that we've been trying to do our best in addressing.
Great, thank you. Now, this kind of leads perfectly into a kind of the next question that I have for all of you, and some of you kind of touched upon this, but how has COVID changed the current direction and focus of the work you do with your respective communities?
Well, Chris, I can say that COVID has completely been a disruptor, at least to the YMCAs and the community-based programs that we provide and services. During the midst of this pandemic was probably some of the more difficult months as a professional I had. I mean, we had to reduce our workforce down to almost 85% to 90%. We only had about 10% of us across the state, while we're trying to provide emergency childcare, and we repurposed our facilities to meet local community needs. And while we're doing so, our childcare workers, those are working our ECE and our in our preschool who we needed, who we leaned on to provide the services to the children, also found themselves also looking for emergency child care and was very concerned with COVID and really was considered to be kind of hazardous work. So we had to flip ourselves inside out, where we had the dubious task of making sure that we're meeting those community needs, but at the same time, our workforce, even though we significantly reduced, was also a member of those communities, and COVID has significantly impacted them like you won't believe. I will say that from a public policy perspective, we work very closely with the Murphy administration. We work with federal government, and we were able to really advocate to have some of these waivers waived so we can feed more children through the SFSP program and the CACFP program. And I'm hopeful that those waivers will be extended because we need to take a really good look at community eligibility. Remember, I just mentioned that we had some that were in the upper middle class that fell down to lower middle class and to poverty. So now we have communities that were already about 80% free and reduced lunch, already had a designation of community eligibility. Now we have other schools and school districts that are now falling into that category. So we need to take a really hard look what COVID has done, how disruptive it has been, and how do we continue to get food into the hands of the children that need it by taking a look at the policies that currently govern us.
I would like to also say that for us, for GVCS, also COVID disrupt our activities just like yours, but it didn't change our focus. So we always try to, always the focus is helping families, helping children. So although we are working with less volunteers, because of the same reason, many of our volunteers who come to our school, they do not want to come to school where unvaccinated children are in the building, right? Because we don't have the vaccines yet for younger students. It has changed in that way, but also it has made us to pay more attention, closer attention to the well-being of our students, especially with mental health problems that we are having now, we're dealing now. We are making more phone calls now than ever. We have our wellness team making periodical phone calls to parents and students just to check how they're doing. And we have noticed that more and more people are now more comfortable, more students, to talk about their gender preferences. So now, it is also good. We always try to see the silver lining on all of this. So now kids are more open up. They are opening more to us. We are also being part of that journey. We have invited, the social workers have been invited by the students to be part of that process. So now they are feeling more, now that students are back in person in the building, they are more confident to talk about their personal issues and their struggles. Another thing that has been affected to our number during the very hard time of the pandemic, we usually serve, our food pantry serves 35, 40 families. And during the pandemic, we were providing food to 110 families. There were some weeks. But we were very lucky also to partner with Youth Corps. So because we also have students who were living in hotels. So we also have homeless students. So we always try to reach out to community to partner with other agencies. So Robert Wood Johnson, again, through their outreach program, help us, delivering food to those families, to those students who were not able to come. We also were able to hire, we had to hire a second full-time social worker just to provide for the needs of our students. We also created a resilience fund to help families who were affected. They were families where mom, dad were all infected by the virus. So there was no way that they could provide for the family. So besides us providing clothes from our closet and food from the pantry, we had this resilient food fund where other families who were fortunate, they were chipping in, you know, contributing to help other members of the community. So that fund is still happening. You know, we were able also to help families now who were affected by Ida. We have 4 families whose house flooded totally. They lost everything in during Ida storm. So thanks to that funding, that fund that we created for COVID, and it is still going on, we were able to help these 4 families to pay for a new place to live. So yeah, so this year our team is like, let's bounce forward. You know, we know that COVID is going to stay here for a good amount of time with us. So we, as I said, we also were affected, but we are also trying to make now more than ever more connections, so the children still receive the services that they deserve.
Well, I would say, I mean, it's really kind of helped us to be more creative as well in terms of thinking about how we kind of develop our programs and sort of develop our outreach strategies. I can say, I mean, we've been so grateful to work with GBCS and to learn from, you know, the wonderful teachers who are part of our Ready and Healthy for Kindergarten program, Lydia Sell Johnson and Diana Galindo, in terms of how well they use the technology to engage families, to engage children. So it's been a really terrific learning experience in sort of a community partnered way. To really think about, and in a lot of ways, although, you know, like it certainly presents challenges. I mean, there's, you know, there are some real advantages to be able to leverage these sort of online strategies to make it more convenient for families to participate. Where in the past, you know, like, you know, having them come somewhere or asking them to join something in person may not have been as doable as, you know, being able to cater to them directly and to deliver content directly into their homes.
And I would just add that working with college students experiencing food insecurity, obviously when Rutgers closed down, there were a lot of shifts. Some students who were on campus who had meal plans went home to families that may be experiencing food insecurity, and we saw the lines in the, you know, on the news with at pantries around the country. So we know that some students who were better off on campus were out in the community with their families or not with their families, but experiencing food insecurity off campus. For the students who were here, we had to change our operations of the pantry. We had a mobile pantry that went around. A lot of international students stayed, and they told us, the students that were still using the pantry, that were still on campus, told us that the pantry felt safer to them than going to stores. So they were still, the students who stayed were sort of using the resources that were on campus more intensively than they had been before. But one of the things that's interesting, I think that COVID really did was shine a light on this as an issue off campus and on campus, that certainly our faculty started to understand in a way that maybe they hadn't before, that students were experiencing housing insecurity. They couldn't just log in from their desk at home because maybe they didn't have the technology that they needed to log in, or they didn't have privacy to do classes, and that all of this is connected also to food insecurity because it's really all the results of poverty and systemic issues. So it really raised a lot of this up in people's consciousness in a way that I don't think it had prior to the pandemic. So.
Thank you, Dr. Houghton. Thank you all. Clearly, you know, COVID has impacted so much of the work we all do and the way we view the world in a lot of ways. And it certainly had immediate impacts and maybe temporary changes to kind of the direction of your work, as you just mentioned, how you had to, you know, shift the focus in what you were doing. But I'm curious, you know, what what are the future directions of your various organizations and the work you do? Is there anything from what has transpired over the past year and a half that is going to continue moving forward? And what may be some other things that are on the horizon for the future direction of your organizations and groups?
Well, Chris, from our perspective, since I'm with the State Alliance of YMCAs, and we have 32 corporate YMCAs, but we are a separate entity. We really want to focus on working with our policymakers. There's been some significant changes through the CARES Act and as well as the Rescue Act. And although there's been some commitment to child care subsidies and incentivizing childcare workers and providing stabilization grants, there's still some small nuances that are within policies that's preventing us for doing the best job that we can. I mean, we know that we have home facilities. We have other facility-based childcare facilities that need significant help. There are some stats that should be really alarming to all of us. We've lost over 2,000 child care providers in this state since COVID. If you take a look at the list on the Department of Human Services website, we are down almost 2,000. So that means us for a YMCA, and we have a workforce shortage. We have over 200 children, working moms and families saying we need child care. And the YMCA saying we want to provide you, but we cannot jeopardize quality, our staffing ratios in order to bring in more children. So if our wives are having 150 and 160 children on the child care waiting list, our economic recovery is going to go at a snail's pace. So from a policy perspective, we need to give more resources to child-based, home-based facilities. They need to build their capacity so they can open up so we can have more child care that's been provided. And on the food front, pre-COVID, 1 out of 9 children suffer from food insecurity. Now that number is 1 out of 5. There's been a 75% raise in children that are suffering from food insecurity. And if it's a child, it's also families that are suffering from food insecurity. We have a ways to go. COVID has not only unraveled, but has even dug deeper at the root causes of these issues. And a lot of that remains in the social determinants of health and in poverty.
So I would just say, again, from the perspective of college students experiencing food insecurity, there's been a real push to to provide a more systemic approach to addressing it and a more coordinated approach across the state of New Jersey. So the New Jersey Office of the Secretary of Higher Education in the summer of 2021 identified 11 New Jersey colleges that are considered hunger-free campuses, which doesn't mean necessarily that we don't have hunger on our campuses, but that we are campuses that are addressing this issue. And Rutgers, New Brunswick is planning to convene a statewide gathering of colleges across the state as part of the grant that we got through the Hunger Free Campus Act. And trying to work together across schools, share resources, solutions, and really address it on a statewide level. And again, as I mentioned earlier, the future direction is really trying to get students involved also at the statewide level. So NJHKI is going to partner with us on our statewide gathering. There are Rutgers student advocacy groups like Students of Rutgers Against Hunger. Our student government is very active, and there was a group, the New Jersey Food Democracy Collaborative, that convened a meeting that had a lot of students there. So really trying to build up that student involvement is another piece of what we're doing.
I'll just add to that. I mean, we a lot of what we've been kind of thinking about is how do we really kind of engage youth and adolescents around these issues, and sort of, especially those from underrepresented minority backgrounds, and thinking about kind of capacity building and supporting them, and really helping to get involved to address these issues. And so this has been something that we've been really kind of thinking about. How do we sort of engage youth in this process at a time where I think too many are sort of feeling, marginalized or sort of pushed away from engaging in this kind of work. And so how do we inspire them to really help support them?
Yeah, from our perspective as a school, you're always trying to get students involved in civic organizations, and to be able, we always let them know that they are the change. We need change in politics. We see that students with undocumented parents do not receive SNAP benefits. So we know that immigration is a complicated topic, but we also know that we are punishing the children by not getting the food that they need. They are not receiving the nutrition needed in order for them to learn properly in school and to develop properly. So our direction would be that, help students be more involved, learn about the problem so they can fix the problem in the future. And also as a school, to try to continue with engaging with different organizations like the ones that we are doing, because we have seen that it works. It has worked for us, like partnering with different organizations like the YMCA. We are also big partners with the YMCA, Raritan Valley, and they offer wonderful programs to our students. So through those programs, we are empowering our students. So that's our direction, will be continuing making these partnerships with different organizations and create awareness in our student population. With our student population.
And Chris,
Great,
if I may add,
yes.
A lot of our direction is trying to respond to community needs. So we know each community is different. Each community has been impacted by COVID in a different way. I believe if you look at COVID Act now, I want to say close to 74% of New Jerseyans have received either at least minimally the first shot of the COVID vaccine, but we still have another 25%. And the simple fact that the emergency vaccination may be approved for ages 5 to 12, the Department of Health is asking the YMCAs, because we do have a lot of them in our programs and we see their parents, how do we begin to educate them? How do we begin to provide a level of awareness while we respect their religious right and their medical conditions and their philosophical differences? So we're trying to pull our communities together to be as safe as possible, but we have to meet the communities where they are and not necessarily keep pushing stats into their face.
Darren, I think that's a great point that kind of leads into my final two questions that I'm going to kind of pose to all of you. We've talked about the successes and barriers that your groups and organizations have had, how COVID has impacted, your operations and the work that you do, and kind of the future directions of the work you do. But I think an important piece too is, are there directions or other communities that maybe we're not catching, we're not capturing, we're not maybe focusing on, that we should be expanding our focus towards? And if so, how can the collective we, meaning not just New Jersey Healthy Kids Initiative, but the greater Rutgers community, community engaged groups, health practitioners, researchers, academics, et cetera, how can we partner in these future directions to address these possibly underserved, or I hate to use the term forgotten, but maybe overlooked groups or communities?
I would like to say that maybe that we need to target marginalized groups, with these programs. And also you as the New Jersey Healthy Kids Initiative also needs to have in mind those barriers and those difficulties that these marginalized groups face, and have them in mind when you plan your funding or your budget. For example, I'm thinking, when we were part of the athlete mentor program, we could not provide transportation. We don't have the resources, and the students could not. Some of them cannot do not have transportation to bring the students to your facilities. So Dr. Komolo has to work really, really hard to get us transportation and everything. I am not sure if it was part of the planning of the program, but she was able to get transportation for our students. Without that transportation, our students would never benefit from that program. So I would say that when you create those programs, please also keep in mind the barriers that may come with the program itself, and also keep in mind a marginalized group, the Black and Latino communities. As Dr. Anderson was saying, we're going to face reality very soon, because we know that Latino and Black communities are hesitant to get the vaccine for their kids because of religious issues or difficulties or beliefs or whatever it is. So we need to educate and inform, not educate, inform families. So I think if the New Jersey Healthy Kids Initiative can create talks like doctor talks or something like that, to create awareness, to inform families, I think that would be very beneficial for the community, for all kids in the community who may or may not get vaccinated.
This is as part of some of our work around increasing access to testing in underserved populations for COVID. We spent time sort of engaging Black and Latino communities in terms of sort of understanding their thoughts around COVID mitigation behaviors like mask wearing and testing, and as well as the vaccine. And one thing that just came across so clearly was this information seeking and the need to really provide good sort of information, but also from trusted people. And so, and I think about even sort of my own sort of journey, as a Latino healthcare professional, thinking about, in the very early stages, as the kind of a new vaccine was kind of coming out and sort of my thoughts about it, having the opportunity to speak with people like Dr. Rabson were so helpful in terms of helping me to sort of come to terms with, making the decision to get the vaccine as soon as I could. And I think the opportunity to be able to provide access to these kind of experts, certainly it's been something that we've tried to do with NJ Heroes too. And, bringing people like Dr. Marty Blazer to speak with our community partners. But I think there's a real role for dissemination in terms of connecting kind of the expertise to the community and bringing it directly.
I would add that I would sort of echo that we do see that Black and Latinx, LGBTQIA students are all disproportionately affected by food insecurity when they are in college. So those are communities that we need to be focusing on specifically when we're addressing this. In terms of future directions, I would say really policy level changes, particularly with SNAP, is a really important direction for addressing the issue of college student food insecurity, and understanding how the expanded SNAP eligibility during the pandemic has affected food insecurity levels among college students. I also think, how we at Rutgers can expand our work is also doing work with community colleges who may not have the resources that we have here. Community college students across the country experience food insecurity at much higher rates than four-year college students do. So really trying to create those partnerships and expand our work to help to work with students in all colleges, not just four-year colleges. And then specifically the New Jersey Healthy Kids Initiative, I would say in the future, it's been great that you've been supporting college students. And I should say, and I meant to say this earlier, not all college students are under 21, right? We have plenty of college students who are non-traditional age, who are not children by any means, but by including college students and addressing food insecurity among college students and nutrition education among college students as part of your work at New Jersey Healthy Kids Initiative, that's been really helpful, and doing some of that nutrition education with our students in the dynamic way described in the earlier talk by Dr. Cook, that I know many of you, do on campus, has been really helpful. And I would just say continuing to really move, from food security to nutrition security, thinking about not just providing food, but providing healthier food, and continuing that work is a really important element.
Chris, I see community several different ways. I know that the South Jersey Population Institute, South Jersey Institute for Population Health, just embarked upon something I think is really cool. They just they had called for proposals for research projects, but the research projects, I think about 10 of them will be kind of led by academia with community partners, but the other 10 has been led by community, and they've been assigned an academic or PhD partner that can help them with evaluation and metrics and some success indicators. And I believe that's the new way of the world, where if we really truly are interested in conducting research that is meaningful, not the dissertations that we did 20 years ago where you completed it and you simply put it on the shelf and you just brought it back out to show it to your children to prove that you actually completed your credentials. We need real life partnerships. We need to leave our credentials at the door. We need to bring our empathy to the table. We need to truly understand what are the root causes that are taking place in our community. And we can no longer, as academians, even though I work in the industry, I still are adjunct faculty, we cannot bury our head in our community of academics, where we're just simply trying to determine what's going to be our next research project and what's our next RO1, or how we're going to be able to continue to bring in these research dollars, these indirect dollars to keep our work going. That's extremely important. But how about we start to work in a particular way where we bring community into our classrooms while we're instructing the children, so they can get real life examples. We get interns all the time, and the first thing that we do is we try to, now in this new COVID world, it's very much more difficult, but we try to get them out to the community so they can truly understand that the theory that they learned in classroom and the practicality was happening in the community. Guess what? There's going to be kind of a dichotomy that's being created, and how we're able to navigate with critical thinking, but also to be able to be culturally competent to work in these communities. So we need both communities to come together, academic. We need communities to be able to come together, and we need to make sure that we're impacting those marginalized communities and building relationships way before we get those grant dollars. Because communities are tired of getting contacted after an organization have received $5 million to say we want to partner. They need to be at the table as you are considering applying for their request for a proposal or call for a proposal.
I don't think we have a better place to kind of tie this all together. I mean, those are just fantastic points that you all raise, and particularly to end on that note, Dr. Anderson, that was just a fantastic point of, like you said, getting outside of sometimes that academic bubble of just focusing on, grant raising and research and whatnot, and actually engaging community, like you said, not after the fact, but from the start. I think it really is so key and important. We do have, some time remaining. So what I want to do is kind of open it up to the audience. If there's any specific questions or comments you wanted to pose to any of our panelists here, we have about 10 minutes or so. And if any of the panelists would like to add any additional comments, please feel free to do so. But you can either type your questions or comments in the chat. I'll keep moderating that, or if you'd like to raise your hand, I can unmute you so you can speak via your microphone. I'm seeing a lot of people saying thank you and praising that last point you made, Dr. Anderson, in the chat. So like I said, it was just a great way to tie this all together.
I'll ask sort of a question, which is to reflect the theme that we're hearing and obviously know, is that, you know, we are in this crisis with COVID, and that it really has reoriented just about everything. And Dr. Anderson spoke of it so eloquently. You know, there's sort of an old saying that when you're in a time of war, you just sort of throw guns at everybody and get out there and try to win. But on the other hand, we also don't want to lose, you know, a focus on overall improving quality of nutrition, et cetera. You know, how do we make sure people get fed, but not lose what we need to be thinking of in the long term? And the answer isn't to go to Pam Cook's shopping, you know, the picture that she had, and just sort of scoop up all the processed food and send it to the people who need it now. I mean, maybe that is partly an answer, maybe not, I don't know, but long term, you know, how do we make these transitions?
In my humble opinion, I think it all begins at school, educating and home, obviously, educating students about healthy choices since they are little. And in kindergarten, like as I mentioned before, we have partnered with New Jersey SNAP Ed, and they bring classes to our students. They have a wonderful series of classes. One is called Cooking Matters for Kids, and the second one is Cooking Matters for Teens. So they are targeting students at an early age, 5-6 years old. So the Cooking Matters for Teens is 2nd and 3rd grade, 7-8 years old. And sometimes the students do not know where the food comes from. It is true. I could relate to that, to the presentation of the previous panelists saying that a 3rd grade didn't know where the food comes from. We had students who were surprised to learn that they could grow grapes. So when we started planting grapes in our garden, you know, they were amazed and they were hesitant to try them. You know, they didn't know that they were edible. So, and that is very important. I think if we start educating students at an early age, that's the first step. And that information will get home. And then programs like this, like the ones that New Jersey SNAP did, they also had programs for parents that is called Just Say Yes to Fruit and Vegetables. And parents were introduced to many vegetables and herbs and spices that they were not used, or they don't use in their day on a daily basis. So once that they lose the fear of trying, they will continue doing it. But first we have to expose them to different things. So I think education, like in our case, education would be the key. So bring healthy programs and nutrition programs to schools, and I think we will start seeing the difference. Make it part of the curriculum. Our school is fortunate enough to have healthy nutrition classes as part of physical education classes of our health program.
Can I add something here? Yes.
Sure, absolutely.
So obviously I agree that education is really, really, really important. And I just want to share a very short story. When we were doing the food, health, and choices curriculum that I mentioned briefly in my talk, which was with 5th graders, one of our doctoral students interviewed 18 of about 1,000 kids that we worked with. And 7 of them said that they really wanted to make the changes, that they were inspired to make those changes, but their communities around them weren't making it possible. So we need education matched with really understanding that communities, and particularly communities of color that have had systemic racism, don't often have a lot of the healthy food. So just to share two things, a negative and a positive. One of the students said, well, you know, I really want to eat healthy, but my family doesn't really have many resources for food. I have an aunt who works for McDonald's, and we're really lucky when she gets to bring home the leftovers and we get to eat that, because that was the only food that they had. So not that she necessarily wanted or didn't want to eat the McDonald's, but that was the food that the family had. A positive thing, that very school where that girl attends, since then, there's been a person named Tony Hillary who started something called Harlem Grown that is growing gardens right across the street from that school. And then having the students, from what they are learning, then demanding in the small stores around the school to start carrying produce so that they can have it in their community. And that's where then you can have education and community change and elevating the community. And what I showed in my talk, that addressing food apartheid and making healthy food available is, you know, that's what we can help to make happen. Thank you for letting me share.
Can I second Dr. Coach? I think it is very important that we make vegetables and healthy food accessible to the community. We have wonderful farmers market in New Brunswick, but sometimes the parents do not have the transportation. So how about we have shuttles to get to those farmer market, you know, in New Brunswick? I remember the fresh, there was a supermarket in downtown, that fresh produce or something like that. And then they used to have those shuttles, you know, like there are other food farmers market who can benefit from shuttles like that, you know. Make the vegetables come home, you know, let them get home, you know, make them accessible.
You know, one of the things that we need more of is innovation. When we think about the work of public health, you know, all the hard work we've done in tobacco control, and then what the tobacco industry do is they come out with vaping and they add flavors to try to entice the children. We worked extremely hard, you know, working with McDonald's to get toys out of Happy Meals, because we know those things were incentivizing children because that would be their default choice. Those little small things of innovation that we've been able to counteract, but we're not on the offense regarding public health. We need to do better with innovation. I may give you just 2 ideas that may just kind of be out of the box. We are blessed to be the statewide technical assistance providers for the SNAP education program. So we work with all the SNAP educators. We work with the sponsors, with the sites, and with the coordinators. So we get a chance to interface with them and provide levels of training. But we also work with community health workers. So we have 5 YMCAs that have housing units. And in Newark, we have over 560 residents in that housing units. And many of them were experiencing food insecurity. We now have hired a community health worker, thanks to a grant from the Department of Health, that this person is providing the SNAP education. They're making sure that they're encouraging them to get their physical activity. They're encouraging them to talk with their primary care physicians. And we've created a room space for telemed. Community health workers work. What if all institutions of higher learning decide to hire community health workers to work with their programs so they're reaching out into the communities? And what we could do is incentivize them. If they want to get their bachelor's degree, let's put them on a trajectory to get their bachelor's degree while they're working with the institution of higher learning. See, we have these things at our fingertips, but so far we're just kind of stuck in our bubble. We talk about this. We are in our academic bubbles. We are in our community, a wealthier community bubble. We're not thinking outside of the box innovatively. And this is the reason why, in most regards, we're getting left behind. We have to move faster together, quicker, and in such a way that's going to be on a cutting edge.
Thank you, Dr. Anderson. That was fantastic. So we have a few minutes left before we shift into our the portion of the day where we're going to have some of our team members from the New Jersey Healthy Kids Initiative talking about kind of the past of where we started, kind of where we are currently, and kind of the directions we're looking to go to. But I think a good segue into that is a question that Dr. El-Nakib posed. So I'll pose this to our panelists, and if any of you would like to chime in very briefly. Focusing specifically on our work on the New Jersey Healthy Kids Initiative, where do you think we can make the most impact in the community? What do you feel is the most impactful thing our group can do for the various communities?
I would echo what Dr. Anderson said earlier about really treating the community as partners, starting from beginning with them. If we are doing research, writing grants, as I said at the start, it was through doing research with the community that the issue of college students being food insecure was raised to us at Rutgers initially. And I would also say that the College Avenue Community Church, which is a community-based church that's near our campus, heard about the issue, and they were right before COVID providing free lunches for our students. So it's not just that they're helping with the research, they're providing programming that they served over 700 lunches to our students in the course of a 2-week pilot right before COVID. So they're providing the programming too. And it really is a partnership. And it's not that we know everything and we're bringing it out into the community. It's definitely bi-directional. And I think that was a great point to raise and something that should be considered moving forward in any of the work that we do.
Here's one of the things I would say is that I think would be lovely in our public health, our community health and wellness undergraduate programs that we can add a concentration in health equity. And because understanding health equity is not necessarily just about interjecting race and ethnicity into the equation. This is about understanding the cultural differences, which may be better than gender, which may be better than sexuality, which may be embedded in religion. And if we are truly being a representative of the community, we need to be very proactive and intentionally about who we bring on as faculty to make sure they do represent the community. If people walk into your institution and they don't see nobody that looks like them, they're going to turn and walk back out. We have the same challenges with our YMCAs. People walk through the doors and they consider themselves members. People walk by our doors and don't even consider the why members of their community. That's a problem. And if we're going to get this right, we got to look at a social economic model that includes all in order for us to be sustainable and relevant.
That I think is a fantastic way to kind of wrap this wonderful panel discussion up. We can't thank you enough for being a part of this panel discussion. You all just provided such wonderful insight and perspective that I know I certainly appreciate, as does our New Jersey Healthy Kids Initiative team, but I believe our audience also greatly appreciates all the insight and perspective you've provided today. And hopefully this is just a preview of the great panel discussion we have planned for the afternoon as well. So again, thank you all for being with us today. Again, if anyone has any further questions, please feel free to post in the chat. Some of our panelists may be sticking around and may be able to answer directly any further questions you may have. But again, thank you all to all of our panelists for today. All right, so I'm gonna just, while they're getting set up, I'm just gonna share my screen and I'm gonna shift it to Dr. Dan Hoffman, who will be kicking things off for our New Jersey Healthy Kids Initiative portion of today, New Jersey Healthy Kids Initiative, Past, Present, and Future, which will be presented by Dr. Hoffman, Dr. Kamal, Dr. Paulo Castro, and Dr. El-Nakib. So I'm gonna stop sharing. I'll let Dr. Hoffman share his screen, and please, feel free to start.
Thank you. Thank you very much, Chris, and thank you to everyone who's attending. This is just a fabulous day with everybody coming together and talking about what we've done and what we plan to do in the future. So what we'll do for the next 40 minutes is just, briefly go over some of how we got to where we are, what we have been doing, and what we plan to do in the future with the New Jersey Healthy Kids Initiative. The mission, as some of you may know, is to make New Jersey the healthy state, focusing on childhood nutrition and fitness. This project was started, as you've heard, by Dr. Gillies and Dr. Rabson, and we assembled an excellent team. Some members, such as Mara and David Kroll, have left, but we've added new members. And I simply cannot say enough about how amazing this entire team has been. They've come together, put in an infrastructure, started programs, developed projects, changed projects, and have spread the program throughout the state. And during the whole time, the most impressive thing for the entire team is that they've been working on fundraising and getting grants to continue this work. So again, it was built from a $3 million grant from the Robert Wood Johnson Foundation. We have team members who are educators, dietitians, physiologists, dietitians, and community educators. And what we've done in the past few years is to look at how we can improve nutrition education in the state of New Jersey, not by making new curricula, but by helping schools understand what they have that works and what they have that doesn't work. And we step in to show them how they can change a few things in their curricula to actually improve how the kids view nutrition, culinary skills, and fitness. Now, I just want to go into a little bit of research to show what kind of motivated a lot of this in the first place. And this study from JAMA, conducted by the CDC, was looking at children who were classified as overweight in kindergarten and what happened as they grew into adolescence. And unlike some previous research, which would have the mantra that if you're obese or overweight in childhood, you're 80% likely to be overweight in adulthood. The results from this study were a little bit different, that some kids who were classified as overweight in kindergarten actually lost weight as they grew. And what was most concerning is this point here in the blue, which is that there were a lot of children who were classified as normal weight in kindergarten, but then they started to become overweight or obese as they entered adolescence. And I think this is an important point because we have to focus on all students. It's not enough just to focus on those who are already at risk, but those who are not at risk may increase their risk as they go through childhood. Why this is happening? Well, that comes down to the social determinants of health, which is something we want to pursue in the future. At the same time, we have this study which looks at diet quality. And as diet quality decreases, we found that there's a problem with adiposity. So that with a poor diet quality, you're more likely to be overweight or have excess fat mass. So understanding what influences diet quality in the home, in the community, and so forth can have very profound effects on the risk of obesity in the future. And finally, one of my favorite studies coming out of the University of San Diego was looking at physical activity across lifespan, looking at 9-year-olds, 11, 12, and 15-year-olds. And I highlight these studies because these are things that we can replicate in our diverse state. And what they found was that activity at age 9 was very intense, with a mean activity of about 180 minutes per week. But as the children grew older and once they entered high school, that continued to decrease and dropped down to about 50 minutes, even lower on the weekend, about 35. So we have a lot of problems. We know that overweight and obesity is a multifactorial condition, but we're really in a good position with how we've reached schools to look at social determinants of some of these outcomes, especially when you look at the diverse population in New Jersey. It's about 75% white, 14% African-American, 6% Asian, 7% Hispanic, Latino, or classified as other. And so what we have is a very nice setting where we can address a lot of the questions and problems that have come up, especially when we talk about diversity, and tease apart what is it that is preventing some communities from improving health, what is working in some communities, and how can we bring that to all students throughout the state of New Jersey. So some of our major accomplishments, we did implement school inventories to a number of schools throughout the state. We've collaborated with RWJ Barnabas, and we validated early nutrition education, which is now in use in about 40 schools in New Jersey. We've hosted a number of symposia. We've also expanded our partnership to include Rutgers Cooperative Extension and Rutgers School of Public Health. And we had bi-weekly meal deliveries during COVID. We worked with Greater Brunswick Charter School. And probably the greatest news we have is over the past 3 years, we have raised close to $1 million, which will be matched by the Robert Wood Johnson Foundation, allowing us to advance some of the research projects which we started during the past 2 years. So in terms of the past, this was the original team that we had. We started by building relationships with schools and looking for partners who could help with this. And instead of creating new curricula, we again assessed what is happening in schools and how we can help as a multidisciplinary team of professionals. So I will now pass it on to team members. And again, I just want to congratulate all of the team members for the very hard work they put in over the past 3 years in terms of getting programs started, doing fundraising, and just keeping the Healthy Kids Initiative alive and moving forward, especially during the pandemic. So I'll pass this on to our next speaker.
Thank you, Dan. Can everyone hear me? Yes? All right, great. So as Dan said, our first year of New Jersey Healthy Kids Initiative was spent building our infrastructure, developing relationships, successfully initiating our Symposia series, which we're continuing today, and cultivating our Culture of Health program. Most importantly, Dan mentioned building our multidisciplinary team was the biggest priority. Each team member really brings a unique experience and expertise to NJHKI. And I'm just going to go through, you have our bios, but just to give you an idea of what everyone was bringing to the table. So Dan, as you may know, is the director of the Center for Childhood Nutrition Education and Research. And he was able to bring his extensive experience studying the long-term effects of poor growth on later health with research projects in Brazil, Mexico, and Kenya. Dr. Arnold Rabson, his co-PI, is the director of the Child Health Institute of New Jersey, and he has a long and productive career as a research scientist and scientific administrator. So really great scientific and research background coming from our PIs. We have Roger Grillo, who is joining us today. He has his MBA and is the director for administration and finance at the IFNH. He provides senior level planning, management, strategic leadership for our day-to-day operations. He's basically our go-to for any budget, financing, or our logistics for our program. So a lot of what we are doing would not be done without Roger's support and guidance. Dan mentioned that we had Dr. David Prohl on our team. At the time of our formation, he was our medical director and is a practicing pediatrician with a special interest in children's oral health. So a lot of what was brought up in this morning's presentations really resonated with his mission and his expertise on what he wanted to focus on regarding childhood nutrition. Mara Dometer, our program coordinator at the time, who many of you have spoken with and coordinated with to be at previous symposia, came to us with a lot of nonprofit administrative and development work. And she, similar to Roger, helped us with those day-to-day operations. We have Chris, who we can all thank for bringing us together today, is a clinical nutritionist and also has a really great natural talent for technology, which is why he was so great in heading up today. And then we had Peggy Policastro, who has an interdisciplinary PhD in nutrition and psychology. She's also a registered dietitian, and she brought in her expertise in behavioral nutrition and culinary literacy. I was the last hire in 2018 as the program development administrator, and my expertise was in classroom education. I spent over a decade in the classroom teaching primarily elementary school age children. So my expertise and my doctoral dissertation focused on curriculum design, teacher professional development, and organizational change. Once our team was established, we were really able to then dig in on our work. My colleague, Dr. Policastro, will share about how we went about developing those relationships, initiating our Symposia series, and cultivating our Culture of Health program.
Thanks, Erin. Can everyone hear me? Great. We have accomplished so much over these past 3 years and connected with so many wonderful community partners and agencies, academic departments, I would need probably the entire time of the symposium to discuss everything. So I'll try to limit my discussion today to a few highlights. I just want to start off also by saying that all the speakers this morning were fabulous and truly resonated with everything we're doing here. And it was so validating to hear their remarks, as it truly reflected in a lot of the work that we do. Starting with our Cultural Health Academy. We went into this thinking that we were going to devise an all one size fits nutrition, physical activity, and culinary literacy curriculum. But after deliberations and conversations with our school teachers and administrators in the community, which, as Darren suggested, we realized we had to adjust this. We pivoted to be more responsive to the schools, their staff, their students. And instead of having a one-size-fits-all nutrition, physical activity, culinary literacy curriculum, we tailored an individualized program, which we term school inventories, to best meet the needs and augmented the strengths of our school partners. We designed an approach that we would survey and audit the strengths and challenges that each school would face in improving nutrition, physical activity, and culinary literacy, and assess teacher readiness to implement these changes. We present an individualized action plan and potential interventions, and we'd also provide the technical assistance to implement these changes. And we're happy to say, as Dan alluded to, we're still going really strong with connections to schools throughout New Jersey. One such example of this work is our working relationship with Acelero Learning Center. Acelero is an early learning center with a holistic approach for the whole family to get involved in health and wellness. And it serves over 5,000 children and families throughout New Jersey, Pennsylvania, Nevada, and Wisconsin. New Jersey Healthy Kids Initiative conducted school inventories to assess their current standards of practice and physical activity and nutrition. And what we did is we presented the school inventory findings to the Acelero administration and its Health Advisory Council. And as a result, based on these audit that we did, they made changes to their curriculum in the Neptune and South Amboy locations in New Jersey. So we were pretty happy that we had an impact in this area. Another example of our outreach is our education professional development. Just one of our very successful professional development program was with our Highland Park, New Jersey School District, in which we included a field trip right to the New Jersey Institute of Food, Nutrition, and Health to have hands-on training for their professionals on how to incorporate physical activity and culinary literacy into curriculum standards. It's one thing to provide the didactic information, but we had hands-on program as well. And as Pam mentioned earlier, what you may want to do in teaching culinary literacy or nutrition education is to incorporate it into the curriculum. And we did this in a really inventive way by teaching people how to make sushi. So we taught approximately 18 education professionals from Highland Park how culinary literacy could be incorporated into many subjects, including history of sushi, reading, following the steps in a recipe, geography, where sushi originated, and math, doubling or tripling a recipe. You know, most of the challenges faced by educators are fitting in one more thing. So we like to encourage them to fit in culinary literacy, or as Pam described, nutrition education, into already approved curriculums, but using how to cook as a way to not only teach about that subject, but to double up and teach them about cooking skills as well. Next, I'd like to talk about one of our original OG funders, which was the Horizon Foundation. Back in 2018, the Horizon Foundation provided an athletic development program in conjunction with the IFNH Center for Human Health and Performance. And this was a former IFNH center, and we received a $1,000 grant from the Horizon Foundation to support a sport, athlete, and physical skill development program led by student athlete mentors with the goal of improving adolescent health. And as Lilia alluded to before, transportation is an issue, and we realize this. Not only transportation, but access to schools. Therefore, we scaled down this model and did it with a single school, the Greater Brunswick Charter School, and with a grade level of focusing just, on one grade level. And NJHKI provided funds to bus 44 eighth grade students to the IFNH, and these sessions were led by kinesiology graduate students, postdocs, student athletes, and staff. And when the Center for Health and Human Performance closed at the end of 2019, the IFNH and the NJHKI continued to provide funding and the infrastructure by leveraging New Jersey Healthy Kids Initiative funds and from the Robert Wood Johnson Foundation to ensure it continued onward. We utilized space and instructors from the newly added IFNH Center called NEXT, which stands for Nutrition, Exercise, and Metabolism. We also added sessions for kindergartners, and we shifted away the focus towards general physical literacy rather than athletic development. Another area we're involved in with the Culture of Health Academy is the preschool and summer camp programs that are held directly in our IFNH building. And having this there, we are very fortunate to have a living learning laboratory for training our student ambassadors in research methodology. At the same time, providing interactive culinary lessons to preschoolers and summer camp students enrolled in the the Culture of Health Academy. We provided 2 such research studies that looked at ways to increase vegetables and fiber into the diets of preschoolers. Bodacious broccoli and Postabilities found that we can increase acceptance of vegetables in preschool diets if we offer them on pizza. And for Postabilities we found that preschoolers like pasta salad made with a high fiber pasta just as much as a pasta salad made with white flour pasta. And we took these findings then and presented them at local and national conferences. We have collaborated with our friends from the Monday campaigns. I know a few of you are on this symposium as well, and you become wonderful collaborators of ours for the past 4 years on so many numerous projects. Based on research around Mondays and behavior change, the Monday campaign is about using Monday as a jumpstart for positive behavior change. We've collaborated with the Monday campaigns on their Kids Cook Monday program to promote family cooking nights on Mondays. With another fabulous collaborator, Wholesome Wave, which Kara alluded to before, we had the support from this national organization working to increase affordable access to fruits and vegetables to people who struggle with hunger. NJHKI and Cooperative Extension staff distributed Walmart gift cards for fruit and vegetable vouchers valued at over $25,000 to 131 families at Acelero Learning Center Head Start sites, 50 Price Fellows students. And as Kara alluded to before, we have Rutgers students on campus that struggle with food insecurity. And these Rutgers Price Fellows students are a very special group, as this group has aged out of the foster care system. And there's a special program within our social work department here at Rutgers, and we partner with them to distribute these Wholesome Wave fruit and vegetable vouchers. We also distribute 155 of them in New Brunswick to families and 86 in Patterson at public schools. And what was really interesting and rewarding was we went into the schools for back to school night, and we were the most popular table at back to school night, and parents were lined up out the door around the block to sign up for our vouchers. So at this point, we're using this as a research study, and Walmart is providing us with the purchase data of how these cards were used and what was purchased. And we're collecting data on these purchases for a manuscript that Sarah will later discuss. I'm now going to turn it over to Dr. Erin Kamalo, who'll discuss our current participatory research and piloting model as we pivoted in response to COVID.
Thanks, Peggy. So like you said, a lot was accomplished in NJHKI's inaugural year. Of course, our story, very much like everyone's this morning, is not complete without talking about the impact of COVID. In response to the pandemic, NJHKI was unable to visit schools for observations and inventories. We are unable to guest teach culinary literacy lessons or host fitness field trips for our local students. So we had to pivot our approach to serve schools and local communities to continue providing that nutrition education, culinary literacy, and physical activity to children across the state amidst the ever-changing situation. Rather than canceling activities and school engagements, we, like many of you and many others, adapted our approach for a virtual format. The development and creation of new approaches, such as our culinary literacy and fitness videos, which are featured on our website if you go and check them out, And our summer food literacy summer program helped us to see the feasibility, facilitators, and barriers related to the virtual approach to education, which does not seem to be going anywhere soon. Not only were we able to continue our outreach and education using these virtual programs, but we were also able to use our findings to, one, develop best practices and share lessons learned, two, prepare manuscripts and presentations describing these exciting new approaches to facilitate their dissemination, and three, to improve, create, and present future programs such as our renewed Horizon Foundation grant Culture of Health School program, our Healthy Helpers Culinary Education program, and enabled us to submit 3 USDA grant applications. Peggy will share a bit more about these adaptations and accomplishments over the past year and a half.
Thanks, Erin. So circling back to our Friends with the Monday campaigns, the New Jersey Healthy Kids Initiative partnered with them again during COVID to promote Move It Monday. So this is an example of another outreach we did in which we included a social media campaign, video content, and video inspiration to get physical activity increased. And NJHKI produced a video series, again, as Erin mentioned, that is on our website, modeling creative approaches families could incorporate into their daily routines. It's one thing to tell someone, take a walk more, but to give them specific directives on how to do this in a fun way is what we were looking for. So approaches included make your walk a work of art. Using route tracking apps, make your walk a circle, a triangle, a rectangle. Fun walks with four-legged friends, our pets. Foraging footsteps through forest to spot local plants and wildlife while adding extra steps, and walking your way throughout the day during daily activities. So this was a great outreach program and featured on Courier News, but also with everything we do in community participatory research, we provide a way to assess the data. And for this, what we did is we looked at the data, looking at key performance indicators for engagement, and developed a research abstract out of this using our student ambassadors, not only to make the videos, but also to help create the research abstract for presentation at local conferences. In early 2020, during the very first months of COVID lockdown, NJHK never stopped, as Erin mentioned. We pivoted our in-person education and assessments at schools to providing meal deliveries, as Dan mentioned in the beginning, for families in need and also developing virtual learning materials. These included cooking demos and physical literacy instructional videos that were developed by our student ambassadors and Rutgers kinesiology graduate and postdoc students. And these were shared with schools, organizations, and part of our Rutgers Day presentations. These also can be found on our website. And then during the summer of 2020, we implemented a virtual food literacy program called Grow, Eat, Prepare. And originally this program was supposed to be conducted in our Culture of Health Academy, but then COVID hit and we had to pivot. And this was at the very beginning, before Zoom became a household word and it was a noun and a verb. So we were learning a lot along the way. This program was basically developed and implemented by a Rutgers School of Public Health master student and a Rutgers George H. Cook undergraduate scholar under the direction of Erin, myself, and Chris. And for 6 weeks, over 30 participants learned about where their food comes from. Back to, again, Pam's talk, the whole food system, how their food is grown, how to prepare healthy snacks and meals. So getting in a lot of that sustainability and the food process. And once again, providing outreach, but also looking at data. So we go into place and say, hey, we have this wonderful program for you to teach skills. And can we do some data and can we do some surveys? We're going back now and initially looking at that data, and this reflects our improvements. And what the data shows basically is showing improvements in food literacy and healthy food intake. But most important, what we learned from this are best practices for virtual programming. We started this when, again, Zoom wasn't a household word. People didn't know what to do with it. And we really now are speaking about best practices in virtual learning presented at Society of Nutrition Education and Behavior, the National School Health Association, and next week at the New Jersey Education Association meetings. This was a pilot study, and once again, we're using this to inform future programs and for our grant applications. And right now we have a manuscript in progress. Healthy Helpers is another example of one of our virtual programs, collaborating again with our wonderful friends at the Greater Brunswick Charter School. Thank you, Lilia, for always being a fabulous partner. And we use virtual culinary literacy classes over 6 weeks in which we're teaching and assessing culinary skills and knowledge. And also what came out of here too was looking at self-efficacy, which Pam was talking about in terms of how to lead different directives of change. So not only were we looking to increase vegetable intake, we're including methods to study self-efficacy. We taught 4th and 5th grade students in health classes to prepare the same recipes with and without vegetables, and we assessed their acceptance of these items. And we found that vegetables hidden in a pizza pocket were most favored, and that self-efficacy, which is so important in directing changes, was definitely increased. And we're hoping that this is the first step towards behavior change. The kids were excited, they were happy, and they wanted to share. And also a manuscript for this study is in process. So you can see it starts first with building collaborations, outreach, data collection, analyzing, and then the manuscripts. We're at that point right now. We're also happy to report that the Horizon Foundation grant number 2, Culture of Health School Program, in partnership with the Rutgers Cooperative Extension, is continuing to implement a Horizon Foundation grant. And in response to COVID, the program has shifted somewhat from in-person field trips to the development of online games, working with our Gaming Institute at Rutgers and instructional videos. Another interesting thing that we did this past summer is we offered an internship program for professionals. We work a lot with our students, but our professionals contacted us. They read about us. One of them after reading about Erin's publication in the New Jersey Education Association magazine. And we designed a summer internship program. And what we did is we developed professional modules on teaching culinary literacy in the classroom or in programs, but also one on mindfulness. You know, we recognize that mental health is just as important as nutrition and physical health. So we came in with a mindfulness module that hopefully will be picked up by various schools. Over this time, we received grants from the Mushroom Council, and as Karen mentioned, from the Higher Education Division of Higher Education looking at food insecurity on campus. We resubmitted 2 USDA grants, 2 new USDA grants, and now we're also looking at sustainability and climate change. And also a really innovative farmers market promotion grant, getting back to what Darren said about being innovative. We're looking at how can we get fresh produce to those that are living in areas that don't have fresh produce and those that don't have transportation. So in this grant, we worked in including how to transport these items from farmers markets right to the consumer at door. Also, we're happy to present that the Horizon Grant has been renewed for a 3rd year for 2001 and 2022. Just to mention a few of our publications, there was a book chapter on dental health in the Pediatric Nutrition Handbook that Dr. David Kroll was involved in. We had a publication in The Review, which is an NJHKI, New Jersey Education publication on empowering learners, an article in the manuscript, in the journal Nutrients on a special issue entitled Green Environment, Effluent Reuse and Waste Recycling. We've had so many presentations, community and research, presented at NYU Behavioral Nutrition, Arm in Arm Community Matters, Feeding Children Futures, Hungry and Food Insecurity, national presentations at Society of Nutrition Education Behavior, New Jersey Education Association, American School Health Association. But what I'd like to end with is the awards that we received, not for the many awards we received for our staff, but for our students. Our NJHKI student ambassadors really are sometimes stars of the show. They've been honored to present abstracts and presentations at national, state, and local conferences, and they've received awards and scholarships based on the work they did with us. And so that makes us really proud. Now I'd like to turn it over to Erin, who'll discuss NJHKI's future directions.
Thank you, Peggy. It really is impressive when you see it on paper how much we were able to accomplish in the face of adversity. It makes me really proud to be part of this team. In addition to our programming and engagement, we also saw a change in some of our personnel on the project, which Dan mentioned at the start. While we were really sad to lose Dr. David Kroll to an exciting career opportunity, it gave us the opportunity to hire Allison Brown, who has her master's in community nutrition and is also a registered dietitian. She came on to NJHKI as our project manager. She has been an absolutely vital asset for us, taking a significant role in preparing and managing our research protocols and documents, connecting with our school partners to conduct informal needs assessments, coordinating programs, and utilizing her expertise gained from her focus on community nutrition. With the support of our student ambassadors, Allison has developed a culinary nutrition education curriculum, the Healthy Helpers program that we just mentioned, complete with all the lesson plans, presentations, bilingual cooking demonstrations, and take-home recipes. We were also sad but proud to see our project coordinator, Mara Dometer, transition from our team to work at the Cancer Institute of New Jersey. Her replacement, Faith Paulshe, will be starting with us in December, and we're really excited to add another highly motivated team member with experience in the K-12 school system. In addition to Allison and Faith, we were fortunate enough to officially add Dr. Sarah Elnakib, MPH, and registered dietitian to our team. She had been a frequent collaborator as her Rutgers Cooperative Extension hat allowed, and she's worked in many areas of community nutrition for over 10 years. Her relationship with the Cooperative Extension and Department of Family and Community Health Sciences has been an invaluable contribution to our team. Her focus on food insecurity and improving food access has really helped us to broaden our horizons and research and project interests. Now, with our new team in place and many, many lessons learned from the many projects that Peggy has described, we're really looking into the future to continuing to provide school support in culinary nutrition and physical activity programming, continuing to share our learnings and best practices, and really focusing on exploring new research topics, which my colleagues, Dr. Elnakib and Dan, will explain next.
Great, excellent. Thank you so much, Erin. So we are really excited for what's to come. And I think, you know, all of our community work has really led us to this point where we're trying to figure out how to work closer with the community, specifically with communities of color and communities that are, you know, have been disadvantaged, and how to leverage our research to support both national and international work, and really focus on both, you know, providing education to the community, but also really moving the field forward for nutrition education. And so one of the first things that we are really excited about is Princeton Libraries program, where we're working with the YMCA's Adverse Childhood Experiences program to provide food literacy as part of our IFNH Student Ambassador program. And so we're looking at participating in like a 6-week, a 1-hour session program where we could teach participants of the ACEs program on how to, you know, create healthy meals, inspire them to cook at home, and learn about the culinary literacy and nutrition literacy that they need. Additionally, we are interested in sustainability and kind of the intersection between food, you know, climate and people. And so we've been working closely with the Barilla Center for Food and Nutrition, who have developed a program called We, the Food, and the Planet, which is a web application as well as a curriculum. And so we're looking at co-developing a curriculum and piloting it both here in the US, in New Jersey, as well as in Italy, to assess how it impacts healthy eating for students. And of course, with all of the data collection we've been doing, we found it a little cumbersome to collect 24-hour recalls and food frequency questionnaires, especially for young children and families who speak other languages. And so we are working on a collaboration with Diet ID, a mobile application that was developed by Dr. David Katz and his team to assess dietary patterns through easy, simple to use applications. And so we're trying to see if we can measure its effectiveness in youth, especially the 3rd through 6th grade youth that we work with. And then finally, we are extremely humbled and appreciative of Horizon Foundation's continued support of our program. And so we look forward to applying for our 3rd Horizon Foundation grant to expand our culture of health program beyond the grades that we currently are working with and trying to focus on the 3rd through 6th grade program. And like Dr. Policastro mentioned, we have applied for multiple grants, and we have been successful in 2 grant applications that are associated with the climate change requirements that the New Jersey legislature just passed. And so New Jersey schools will be required to teach climate change education for the first time ever, and this is the first state to do it. And so we're looking at either developing supplemental materials and curriculum to help support teachers in meeting these new requirements, as well as the farmers market, the local farm and farmer and food production application at USDA and the Farmer Agriculture Service Learning Program, which is really meant to connect people to farmers markets, especially for low-income folks. And then finally, we have 3 publications and manuscripts in the works. We have the Grow, Prepare, and Eat manuscript that is going into the Journal for Nutrition, Education, and Behavior, the Healthy Helpers manuscript that Peggy mentioned that talks about self-efficacy and improving student inputs. And then, of course, the Wholesome Wave gift cards and trying to assess how incentive programs impact purchasing power and how that might be leveraged for policy change. So that's all of the exciting things that we're working on, and Dan will continue to expand on that.
Thank you, Sarah. So we are at a position now where our funding is, the original funding is going to close, but we have additional funding from the grants, and we will also have a match. So we're really kind of gearing up to answer a lot of research questions that we can use based on the infrastructure that's been put together. And these are just a couple of examples of where we are heading in terms of our research directions. Obviously, we want to look at the validity and the effectiveness of what we've put together. So that's going to be a major force. We also want to consider how can we actually measure health across the state so we can actually give a report card on the state of child health in New Jersey. So we have a lot of unique opportunities within the state. We want to look at the strengths that the IFNH has and how the Healthy Kids Initiative can capitalize on those to continue advancing our fundraising. I think within this context too, once we have a sizable group that we're working with, we can start to conduct research on what influences growth. We are working with kids as early as 18 months and 2 years, but we're also working across a lifespan up through high school. I think the fact that New Jersey is so diverse is really going to be a key issue, which will help us get additional funding because we can answer a lot of fundamental questions about growth, nutrition, and wellness in a very diverse state. So while we do have the ability to measure a lot of key measures of growth, there are many challenges in terms of getting ethical approval, coordinating with families, and I think as Darren and Pam have both mentioned, having a solid relationship with these groups before you begin asking research questions is essential, and that's something we've spent the past 2 to 3 years really doing. We've listened to our community advisory board, we've listened to the scientific advisory board, so now we're in a position where we can start submitting more significant grants. So we have time, I believe, a minute or two for questions, but I also want to thank all of the speakers and panel members today. It's just been extremely exciting to hear from your work and see how we can continue to expand this. But before we go to questions, I again want to thank and congratulate all of the team members of the New Jersey Healthy Kids Initiative for all of the hard work. I think if you were to see the day-to-day, you see everything they've done, put together, continuing to write grants, getting grants, and submitting papers for publication. It's just been an extremely great opportunity to watch all of this come together. So thank you all, and I leave time now for questions. I see the Monday.
Right, so we have a question from the Monday campaign. So I actually just allowed you to unmute yourself and ask a question or make a comment.
Thank you, Chris. I just want to. It's getting. Can you hear me?
We can hear you.
Hello?
Yes. Yes. Now we can hear you.
Okay, because there's an echo.
That's fine. Just go ahead and ask the question.
Oh no, I just wanted to say that it's a joy and honor to work with your team. And I just also want to point out that Kids Cook Monday was piloted under the guidance of Dr. Pam Cook at Teachers College in Columbia University. And we have shared our successes with you, with other schools in New York City and other parts of the country. So thank you for this opportunity.
We have other questions from attendees, panelists.
This is what happens when you go right before lunch.
So if you do have questions, please feel free to put them in the chat. Our team obviously will be on this symposium all day long, so we'll be happy to answer any questions that you do pose in the chat. But I do want to try and keep us on schedule. This is going to be the start of our lunch break. However, before you all scurry off to lunch or to check emails or catch up on some work, we first and foremost want to thank you all for being in attendance today and you know, listening to these fantastic presentations and discussions and recap that we've had regarding not just the work that we are doing, but what so many other individuals are doing and how they're having an impact in their communities. It's been a fantastic morning. However, this is not the end. We still have a fantastic schedule set for the afternoon. So we do hope that you will return to rejoin us promptly at 1 o'clock, where Dr. Christina Economos will be providing a fantastic presentation, followed up with a very wonderful discussion with another set of panelists that we think you're all going to absolutely love and enjoy the discussions they will have. So we welcome you to, go take your lunch break, do whatever you needed to do, and then please return at 1 o'clock to join us for the afternoon portion of today's symposium. Thank you all. So I'm going to actually hand it off to Dr. Hoffman to provide some brief introductions, and then we can get started.
Stunning that is. So it's my pleasure to introduce Dr. Christina Economos. Dr. Economos received her undergraduate degree from Boston University and a Master of Science in Applied Physiology and Nutrition at Columbia, and then went on to get a doctorate in nutritional biochemistry at the highly esteemed Tufts University Friedman School of Nutrition Science and Policy. Dr. Economos has authored more than 150 scientific publications and is the co-founder and director of Child Obesity 180. She is currently a professor, the New Balance Chair in Childhood Nutrition and Chair of the Division of Nutrition Interventions, Communication and Behavior Change at the Friedman School of Nutrition Science. So with that, you can take it from here, Chris.
Okay, thank you so much. So really nice to be here. I'm going to make up a little bit of time. Title of my talk is Equipping Communities to Address Childhood Obesity, a Systems Approach. So just to remind everyone, obesity rates are high in the US and there are disparities. So you can see here the difference between non-Hispanic white, non-Hispanic Black, non-Hispanic Asian, and Hispanic children. And I want you to keep this in mind as we go through the conversation today. So I also wanted to make you aware that there are emerging data showing that as a result of the pandemic, childhood obesity rates have risen. These data are from electronic medical records from across the country. And just in short, what it's showing is before the pandemic, you could see obesity rates by age group. Green are the younger children, 6 to 9, in orange, 10 to 13-year-olds, and in purple, 14 to 17-year-olds, kind of gradually creeping up, maybe having a little bit of noise there in the 14 to 17-year-olds. But when you look post-pandemic, you can actually see that the change in BMI is much higher. And these data are from 2 different well child visits about a year apart. So it's capturing children who may have come in right before the pandemic and then during the pandemic, or even 2 visits during the pandemic. And you can see that the change in BMI has really gone up. And this is also shown in the MMWR report that came out from the CDC just last month, where you can see here, this is the estimated overall BMI, and 3 to 5-year-olds, 6 to 11, 12 to 17, and 18 to 20-year-olds. And again, you can see this vertical line showing the beginning of the pandemic. And after that, you can see that the rates are going up. And what's really disturbing is the rates seem to have, the lines seem to have gotten even steeper for children who started out with severe obesity. So these children appear to have been hit the hardest. So keep in mind that these are just overall data. They're not stratified by race and ethnicity, but they are by age. And we would expect that children who started off higher and who are more disadvantaged actually suffered the most. And these data are out of a group in South Carolina who showed us that the changes in weight that they documented in a smaller study were probably caused by a decrease in movement and a change in dietary intake. So looking at the panel on the left at movement behaviors, again, you see a vertical line around the spring of 2020 representing the beginning of the pandemic. And you can see that the sedentary behavior went up and the light and moderate to vigorous physical activity went down. And then if you look on the right for dietary intake, you see unhealthy foods and healthy foods. And what's important here is they both went up. So it wasn't just that unhealthy foods were substituting out healthy foods. It looks like children overall were eating more, and they were eating more unhealthy foods as a result of the pandemic. So it's no surprise that we've seen BMI go up. So I wanted to just put that out there at the beginning so we understand where we're starting right now. I gave a talk a couple of years ago and we were in a different place. And now we need to take the epidemic more seriously than ever and do everything we can to help control it, reverse it, and help children live healthier lives. So in terms of obesity prevention research, this is really my perspective over the last couple of decades, where we had a lot of research that was focused on individual behavior change back in the 80s, the 90s. And as we were approaching the 2000s, people started to think more about the environment that was impacting our behavior. And there were a lot of different instruments and tools and studies that were focused on policy and environmental interventions. That really grew as we understood, well, we can't just change one thing, we need to change many things in the environment. And people started conducting multi-level, multi-sector designs and implementing those in communities. And what we saw there is if you put a portfolio of initiatives together, they actually work better than just putting one thing in place. But that really led to a whole area of research called whole of community approaches. And what I've done is combine the whole of community approach with system science approaches. And I think it's where we really need to focus now to make meaningful impact that's sustained over time. So we know that obesity is a very complex system, and I know most of you have seen this before. It's out of the Foresight group in the UK, but I show it again today because as I talk about whole of community approaches, we can look at this map that shows us what's led to obesity or the determinants of obesity, and we can also put those into context in individual communities. In other words, we can make maps in the location we're working in to specify what the individual variables or factors are that are leading to the development of obesity, which is the energy balance loop that you see in the middle here. So appreciating that obesity is a complex adaptive system. And just as a note, I showed that illustrated by the change in the obesity rates during the pandemic. And this is due to varied interacting and emergent factors within and between individuals and their environments. And this influences our balance between intake and expenditure, or our energy balance. So these data are from the Healthy Communities Study, which I'm sure a lot of you are familiar with. They studied 130 communities across the country and really tried to understand what sort of programs and policies were happening across the country and how was that associated with body weight, or in this case, change in body mass index in children. So in the top panel, you're looking at over time, a change in community program and policy scores in these communities. And that's at the time when I mentioned people were focused on environmental and policy changes. And so in these communities, you see more activity going on in policy and programming, and hence a higher score over time. In the bottom, they've looked at the relationship between this score shown on the x-axis and the change in BMI on the y-axis. And you can see the higher the score, the lower the BMI. So this is really underscoring that policy and environmental changes can actually help control body mass index or weight in children in a community. We've done a lot of work to actually map out what the dynamics of community change actually looks like. And in this case, you're seeing typical microsystems that are in any community across the country: the food environment, school, media, the community at large, the built environment, the family environment, all influencing what you see here on the top as the individual, or in the case of our studies, the child. And all of these microsystems are interacting. And if you put policy and environmental changes into each one of those, collectively, they can influence the individual. If you just change one system, or if you just change one variable within a system, you're unlikely to get an impact on biology. And what we've learned is that in order to make this work in a community, you need a group of people working together in what's called a coalition or a task force or a committee. And these individuals need to work very deliberately together over a long period of time in order to put those environmental and policy changes into place and have them work synergistically over time. So we've really focused our work on the science of coalitions and what happens when you work with a group of people who are multi-sector in a community who can make change together. We looked at the different studies that have been done over the past decade or so, trying to move the needle on obesity or overweight in children. And we identified those that used coalitions in their childhood obesity prevention interventions. And you can see here on the x-axis, the number of community engaged research phases that these studies used, including problem identification, design and planning, implementation, evaluation, dissemination, and sustainability. And the studies that used more of those, in this case, were associated with a greater positive impact or positive outcome within the children. So these are coalitions of individuals working deliberately together, implementing these community engaged research phases and having a more positive outcome on child weight. I want to spend a minute now and add into the conversation what's incredibly important, and that is, how do we get to equity? I showed you in the first slide that BMI, or obesity in that case, rates are very different across children in communities across the country. And so just applying evidence-based strategies in a very generic way is unlikely to get us to equity. This diagram was published 2 years ago by my colleague Shariki Kumanika, who's now at Drexel. And she really makes the point here that to get to equity, we can't just focus on increasing healthy options like we typically do in the food and retail, school and work site, built environment, parks and rec, and transportation sectors. And we can't just reduce deterrence to healthy behaviors. We also need to work on improving social and economic resources and building community capacity. And so we've incorporated into our work all of these quadrants, and we've done it by working with communities, using system science to help them map out within their communities all the context-specific variables that are at play that have led to obesity and that can be tackled using evidence-based strategies and really taking into account all of these social drivers that we know underlie the problem of overweight and obesity. So we are working to transform communities using systems approaches. So we know that working at the community level demands comprehensive, whole of community transformation, supporting healthy eating and active living through systems, environmental and policy change in wide-ranging places. So note that it's not just environmental and policy, it's also systems. So we leverage innovative approaches from system science to bring together cross-sector stakeholders, and we put them through structured activities for a period of 2 years that surface their own diverse and context-specific perspectives, helps them build consensus, diffuse the evidence-based strategies that are right for their communities, and drive coordinated, comprehensive action. And through this ongoing process, we continuously refine the approach, and hopefully we're advancing the field of obesity prevention more broadly through our publications and dissemination. And I want to emphasize that responsiveness to local needs and community readiness are really key priorities, and that's what drives the adaptation of our approach. So where we're working now is really within this middle section of this National Center for Chronic Disease and Public Health Promotion Knowledge to Action Framework. So many of us work in the research phase shown in blue, and many of us really want to institutionalize change shown all the way on the right. But what needs to happen is this translation phase. We need to take what we have from laboratory-based or very controlled discovery and efficacy and even effectiveness and implementation trials and put them into practice through translation. And this is really done through a process of using a different type of science like implementation science, dissemination science, community engagement, and what we're really calling diffusion. So I'm going to spend time now talking about our model and how we study the process of diffusion to get the evidence-based strategies out into the community in order to be institutionalized. So we've come up with a framework that we've published called Stakeholder-Driven Community Diffusion. And I've deliberately put a black box here, which just bear with me for a moment, I'll uncover in a moment. What people typically do is they identify people in a community like child health champions, people who work in schools and childcare environments, possibly in public health, and they give them practices, policies, environmental changes to put into practice and expect that we'll see a change in child health outcomes. But that's really the what. What should we do? We should take the evidence and we should put it into place in order to change health. But the process of doing that is really the how. And we've come to understand and appreciate that the how is just as important as the what and includes its own very specific process that takes a long time to put in place. So what I've just uncovered here is the science that we've developed over the past couple of years, where we convene the stakeholders that I mentioned. We build knowledge and engagement and relationships and systems insights. We help them prioritize what's important for their community and which evidence they should use. And then we help them act. And then we help them diffuse it into the broader community through collaboration. And all of this leads to the implementation of these changes, which can impact child health outcomes. So we think of our process starting upstream in order to go downstream. And you can see there are core pillars of the work that we're doing, including cultivating trust, capacity building, and as I mentioned, responsiveness to community context. So I want to talk a little bit about the stakeholder process and starting with convening how we do it. We take community groups, typically about 15, and 4 is shown here for simplicity's sake. And we take an individual from each of these groups and we bring them together, which you're seeing here in the center. We examine the knowledge and engagement of the individuals that we choose, and we work with them over a 2-year period. And the goal here is for these individuals to form a cohesive group, to increase their knowledge and engagement, and for them to then diffuse this back into their respective organizations and into the community at large. This is an example of a paper that we just published with our coalition committees at baseline showing the network composition. And you can see in the legend that people are from lots of different groups, and they're connected and interacting in a whole variety of ways. We have metrics that we look at baseline that are really important for us to understand how these individuals will be working together, and we can actually predict and forecast what might happen, and then in turn actually work with the group in a different way. So it's the whole science of convening and working with this coalition that we think is really important. Next, what we do is a process called group model building, where we build their knowledge, relationships, and systems insights. This is just a snapshot of people at work doing group model building. It's a whole series of activities that helps people externalize their mental models, work together, and actually map their individual communities. So what you're seeing here are informal maps, which people initially draw together, which we then digitize using computers. And then eventually it turns into their own unique community map. This is actually from Cleveland, Ohio, showing the drivers and impacts of childhood obesity within Cleveland, created by the coalition we're working with. And each of the variables in here are context specific to their community and what they actually believe was important and what they wanted to and needed to work on. Each time we work with a community, the map looks very, very different depending on the context, the group, the historical nature of the community, the population, the demographics, and what's been done to date. You can then take these formal models and work with computer simulation to do a whole variety of things that we don't have time to talk about today, but it's important to forecast and also to monitor what you're doing in real time to see if what you're implementing is working well. We then track the diffusion process using social network analysis, and we prioritize the different evidence-based strategies with the community members so they can act. So just a snapshot of some of the key strategies that we use with communities that are evidence-based. You'll be familiar with many of these. I want to really emphasize that right now is an opportune time to work with USDA on federal policy, including school breakfast and lunch, WIC, SNAP, CACFP, and we have leadership right now that is really pushing forward probably the most bold changes we've seen in decades for these programs. So I would do everything possible to align with that work and to really leverage the opportunity we have right now at the national level. So this is an example of social networks in the communities we're working with. This is just one community. And you can see that over wave 1 all the way to wave 5, that the networks really begin to look different. We monitor things like discussion, frequency, and influence. And as we're working with these coalition groups and they're diffusing out into the communities, we can look at patterns of these different things, and we can actually implement changes along the way to help the diffusion process happen even better. And lastly, we monitor what happens with respect to changes in policies, practices, and environments. And this is from one community looking from baseline to 24 months and showing you a comparable score to what they used in the Healthy Communities study, indicating that policies, practices, and environmental strategies have worked in this community in terms of change. So we're currently working across the country, and I'm just giving you a snapshot here of the communities we're working in. We just brought on 3 new communities through a national RFP. We're really open to collaboration, and we hope that maybe some of you listening will get in touch and see if we can work together. It's a 2-year scientific process that we're really excited to bring more communities on to work with us. This is our website, catalyzingcommunities.org. It's part of Tufts. You can learn a lot more about what we're doing there. So I'm going to sum up everything that I tried to just communicate in one slide. We must start early when it comes to childhood obesity prevention. We have emerging evidence showing us that COVID-19 has increased obesity and the related behaviors. We know that whole of community approaches are needed. Purposeful, sustainable, and evidence-based intervention packages can work. We need coordination and connections between sectors, and we can measure and monitor this using system science. We always have to use rigorous design and evaluation procedures so we can see whether or not we're making change. To reduce disparities, we need equity-oriented approaches and strategies that reach high-risk communities and address the underlying societal structures and disadvantages. In order to scale what works, we need more implementation science funding. We have to train our future leaders with interdisciplinary education and experiential opportunities. And systems change is about shifting the variables that are holding the problem in place. So I'm going to try to stop sharing now.
You did already.
I did already. Great.
Yeah.
Okay. Perfect.
Great. Thank you very much. Let me start the questions with one, the black box you had.
Yeah.
How long did that process take from the convening to the diffusion?
Sure, great question. So in the communities we're working with, we've done it anywhere between 12 months and 24 months. So the diffusion happens immediately. As soon as you get that group together, they go back to their respective networks on a daily basis and begin to diffuse. Initially, they're diffusing their knowledge, their engagement, what they're learning about systems perspectives. And then over the process of about 6 to 9 months, once they prioritize, they begin to diffuse the evidence-based strategies. So we're really working with communities for about 24 months, but the process initially begins as soon as we convene them.
Thank you. And there's a question from Lilia in the chat. The schools are providing free breakfast and school lunches to all students, regardless. So it's a commentary on the policy. So, okay, so I would like to open it up if anyone else has questions for Chris. Arnold, go ahead.
I'll jump in. This is fascinating and just so impressive. And the idea that you're working across the country in such different populations is really essential. I'm wondering whether you're seeing anything or have any advice based on what you've done around this incredible polarization and fracturing that we've seen even within communities with respect to COVID, which obviously is going to spill over to other kinds of health issues.
Yeah, I mean, we were working with 6 communities throughout the pandemic. And so we did a lot of this work remotely. And yeah, I mean, each community had its own problems and, leadership changed in some of the communities. We, generally speaking, are working with public health individuals who are pro-vaccination and pro-mask wearing. And so that tends to be who's on our committees that we're working with. So we haven't personally had to help them work through anything because they've been aligned. But what I think we've really seen is that in many communities, there's been a more openness to working on structural racism and poverty and housing. And again, these underlying drivers that have to be addressed if we're going to reach better health for children. I think the structural racism components that we're trying to help communities with are, something that you can't take on unless you have training yourself. And I want to caution people toward that. I think although everyone we work with is really interested in it, the first thing they tell us is they want some more professional training. And these are both individuals who are white and individuals of color, because there's a process to go through to really do the work well. And those with lived experience have an advantage of being able to start the process in a different way. And those without lived experience really need to go through the proper training to do it. Answering one of the questions around food policy councils, I think almost all our coalitions have a member that is from the Food Policy Council in the community, so they're well represented. We also have another study going on with food policy councils, which is separate.
Can I ask a follow-up question?
Sure.
So a lot of the times when we work on these coalition types of projects, there isn't a lot of funding for the backbone organizations, right? Like the funding to continue this work. There's project-specific funding, but like you said, you have to have a dedicated team for a very long time working on the same things. And so, how do you see kind of the future of this work happening without that funding?
That's a great question. So I think we have to fund them. I mean, we work with the community for a couple of years. We do stipend individuals for being part of the research component, and then we give some money to the backbone organization. It's not that much. And the ROI in doing this work is extraordinary. I have return on investment data from Shape Up Somerville that's published, and it works. And if we're going to make this kind of a change, we have to give, $100,000 to a community to do this work. To be honest, even with $50,000, you can do this work. It's not a huge investment for the return that you will get. I think the infrastructure work that's going on right now in this country and much of the funding that's about to roll out over the next couple of years, in my opinion, could easily be leveraged to do this type of work. This is infrastructure of communities. It works on transportation. It works on the systems in a community from almost everything, as you could see in the Shape Up Somerville map that I showed initially. So we have to figure out a way to leverage some of the money that's coming down and tap into it, because this is infrastructure.
Thank you so much.
Thank you. I think we have time for one more question if we have one.
Okay, well, I'd be happy to hear from any of you. So log on to our website. We have resources on there. We have all our publications. And, I'd be delighted to work with the community in New Jersey. So please keep us in mind. And I'm sorry about the technical difficulties. I hope I caught up for you.
You did. It was great. Thank you very much.
Right. Thank you all so much. Nice to see you. Bye.
Thank you, Dr. Economos.
Thank you. Bye.
Back to Chris.
Thank you, Dan. That's a great segue into our final session of the day, which is our second panel discussion, Child Health and Nutrition Overview and Systems Approaches, which I think piggybacks very nicely off of Dr. Economos' presentation. So I'm going to kick it over to Arnold to offer some brief introductions to our four panelists that we're so thrilled to have joining us today, and looking forward to it. So Arnold, take it away.
Thanks very much. I don't know if you want to sort of end screen sharing so that we can, that's really great. So I'm just going to say, as Chris did earlier, just a few words about our panelists, and then we'll get into discussion and actually really say that we have a relatively small group of panelists and some very interesting questions that I think overlap very much into other areas that have come up during the day. So other previous panelist speakers may also want to comment, and we can open up at the end for more general discussion. First, I'll introduce Dr. Brian Schilling, who's the director of the Rutgers Cooperative Extension and the Senior Associate Director of the New Jersey Agricultural Experiment Station. He holds an academic appointment as Extension Specialist of Agricultural Policy in the Department of Agricultural, Food, and Resource Economics at SEBS, at School of Environmental and Biological Sciences at Rutgers. And the rest of his biography, as of the other panelists, is shown in your extensive program. Our second panelist, Carrie Lakakis, is the Manager of Community Wellness at Newark Beth Israel Medical Center. She's worked in Newark for a number of years and developed programs such as the Kids Fit program for elementary students, and also is involved in training school educators and additional wellness programs and partnerships. Molly Fallon-Dixon is the Manager of Community Wellness Services at Newark Beth Israel and at an RWJ Barnabas facility, has been involved with child nutrition education for many years and has launched a number of exciting initiatives such as the Beth Greenhouse, the Reverend Dr. Ronald Christian Community Health and Wellness Center, and the Women's Wellness Pantry. Again, more information about her in the program. And finally, Dr. Peter Gillies, who many of us have known very well. Peter came to Rutgers in 2010 after a very distinguished and extraordinarily productive career at E.I. DuPont in Delaware, where he was head of cardiovascular disease research and Science Officer and Global Research Manager of Human Healthy Sciences for Nutrition and Health. He came to Rutgers as a professor in the Department of Nutritional Sciences, and he was the founding director of the New Jersey Institute for Food, Nutrition, and Health, which is how we got to know each other, and was the originator of the ideas and then with me, the co-PI as we put this together of the New Jersey Healthy Kids Initiative. So it's wonderful to have Peter back as well. So thank you all for joining us. And again, I think some of the earlier speakers and panelists may really want to weigh in as well, because I think the questions are really quite applicable. But we'll start out sort of just going around with the group for a very general question, a question that I think the previous panel talked about, and Christine, who just spoke, talked about as well. From where we sit, here we are in 2021 with the pandemic, et cetera, what do you see as the most critical issues of childhood nutrition in New Jersey and beyond? So we can just start in the order that I had introduced folks, and then just sort of take it very much freely from there. But Dr. Schilling, would you like to start to sort of think about that with us?
Sure, thank you very much, Dr. Robson. So the beauty of coming late in the program is it's easier and harder because a lot of great thoughts have been shared and there's just too much to react to. So I will say that I think others have really articulated pretty clearly what some of the challenges are. From an extension perspective, when I look at our involvement in things, I really look at kind of the complete wellness profile of children, from the physical to the social to the mental, and all the different stressors that we've seen, some of which were just simply exacerbated under COVID. And I think of particularly some of the social and the mental health issues that we're encountering in 4-H. But I think it goes without saying that obesity and access to proper nutrition is a building block. And it's something that I would say our good colleague here, Dr. Sarah El-Nakib, and colleagues in family and community health sciences spend a considerable amount of time focusing on. And also just more broadly with programs like FNEP and SNAP-Ed, trying to help ensure nutritional education is accessible and impactful. And I'll have more comments on that later. And I'll just say the one thing in the context of overall wellness, I was really struck by some of the experts who spoke prior about the importance, the essentiality of actually understanding the influences positively or negatively on food choices or other child behaviors. So I think that is just remarkably important to understand.
Hey, thank you. Ms. Vakakis. Gary.
Hi, everyone. Thank you. Yeah, I agree, Dr. Schilling, about, hearing all of the presentations that came before us and the wonderful research that was presented to us really alluded to, just as you spoke, that childhood obesity is really one of the most concerning issues. We heard a lot of research, and I'd almost like to speak on more of a personal level when we think about how COVID really upended our lives, and so many of the support networks that families rely on were removed. So from my perspective, I'm a dietitian and nutrition educator, and I'm a mom of 3. And I remember, at the beginning of COVID, walking down and the parks were taped up with caution tape, and just, thinking about some of those things that our kids experienced. And, Dr. Koch alluded to all of the different experiences and how complex our health behaviors are and all of the things that go into them. There's so much research behind it, but we can almost simply say that everything affects everything with this, especially here thinking about how the COVID pandemic has affected childhood eating behaviors, how it's affected families and continues to do so. If we think about some of the individual cases, for example, as this began, my son was 5 years old in COVID. He's now going, before the end of the school year, he'll be 8. These are prime time for eating behaviors. And we know so much, as the research that was presented to us today, how eating behaviors, they are learned very early on. And as a dietitian who also does private counseling and tries to feed their family as healthy as I can, they're very difficult to change in adulthood. Even some of us adults can understand that, right? So I think, you know, we have our work cut out for us in terms of what, you know, steps to go in the future, and just, you know, understanding all the intricate ways that this pandemic really has impacted kids and families. So thank you.
Thank you. Ms. Fallon-Dixon.
Yeah, so I also agree, Dr. Schilling. Coming at the end of the day, we've got a lot to process ourselves. But really, as we talk about obesity and all the obesity research that's come out today, you know, also making sure that we're focusing as well on hunger. We know the hunger obesity paradox is real. We know that hunger and obesity, they live in the same individual, and they certainly live in the same household. So, you know, it's really important that we make sure as we're addressing obesity, we're addressing hunger. The pandemic has really, as we've all said, highlighted everything, especially hunger in New Jersey. We're operating here at North Beth Israel in Essex County, where we're just under 25% for projected childhood food insecurity numbers for 2021, which is up over 8% from where they were in 2019 pre-pandemic. So we've got a lot of work for all of us, and for everyone who's working in the program implementation space. I think it's just this like desire to kind of get back to normal and get back to pre-COVID program implementation and all of that. So I think, you know, as much as we want to do that, I think what's going to become really critical is making sure that we have that food security lens on now. All of us, you know, whether we're educators teaching in the classroom, or, you know, in our case for the programming that we work with local schools on, we do like a train the trainer model for local teachers, making sure that those educators and those that are speaking directly to children and families, they have that food security lens on. They know what the resources are in their community, and they can connect families and children with those resources. Whereas, you know, pre-pandemic, maybe you had a few children in your classroom who were really in dire food security stats. Just really be knowledgeable that those numbers are definitely going to be up now. And so it needs to play an important role in everything that we do as we kind of move into, dare I say, like post-pandemic programming.
Thank you. And Peter.
One of the things I did to get ready for this panel is I polled some of my fellow members of the External Advisory Board as a really outside group and said, you know, what do you think are the critical issues in childhood nutrition in New Jersey? And they had a couple interesting ideas, and I just thought I'd share those with you on their behalf. One that came up in various forums was a question of whether or not Congress and the state legislature have a sufficient focus on food insecurity and supply chains as it relates to school lunches. And I think that's kind of an interesting view of something that we might not have flagged as we have a more academic, medical, or educational focus. There are some other systems that support the goals of the program that could deserve some attention in the future. So I think policy is really important. And I think this supply chain, we're probably underestimating the impact it might be having. And oh boy, if we're not getting these school lunches to the kids, we're in a lot of trouble. On a personal level, I'd like to raise another personal issue in terms of childhood nutrition. That is, as a grandparent, as I start to look after my grandson, I have to tell you, I don't know anything about how to get little kids to eat, let alone little kids to eat something other than mac and cheese. I mean, so if there's any opportunity to get some education and tools in the hands of grandparents to support us in our role of looking after these really young kids, please send them my way. I'm sure I'm not alone in this one.
I really, as a grandparent also, I really appreciate that, Peter, very much so. It is a challenge because you also have to deal with the parents and their value systems as well. So thank you. And anyone else want to weigh in on this one? It's such a key issue. So we'd be happy to sort of entertain other, or perhaps after we go through a few of the other questions, then we'll just really throw it open for more general discussion. The second sort of point of consideration is from a systems viewpoint, and this really tracks very nicely from Dr. Economos' talk. From a systems approach viewpoint, what's the best advice for program development or process design? And well, you know, the question's open for everyone on the panel, but I know Peter had some things he wanted to talk a little bit about. I think had some experience with this as well. So why don't we start there, and then we can open it up for everyone to comment too.
Thanks, Arnold. I appreciate that. I have the advantage of being kind of a historical figure in all of this. And so I'm going to offer somewhat of a historical perspective. And I'd like to start by saying that the New Jersey Healthy Kids Initiative has achieved one of the original critical goals of the Institute for Food, Nutrition, and Health. And that is to be not simply a basic research organization, but also an organization that focuses on community and research. And I think they've been incredibly successful. This is really a remarkable achievement for the New Jersey Healthy Kids Initiative to have gotten as far as they have, particularly in the face of COVID, where they lost the ability to have that direct physical contact in the community. And I think this is a real testament to Dan and his team. I think they show what happens when you have a good vision, you've got dedicated leadership, you hire talented people who are really committed to this. And pursuant to where we are today, they've really engaged in the idea of tackling a problem through a systems approach. So I have to say, well done, folks. You've really impressed me, and you far exceeded any of my expectations I had when I was at the Institute. You know, it's just really terrific to see what you've done. So in terms of advice, I'd like to focus on the importance of advisory boards and the opportunity that they provide to ensure that the Healthy Kids Initiative is a learning organization. And to quote or paraphrase George Lands, the Healthy Kids Initiative needs to learn and grow so that its terrific start doesn't slowly fade away. So as I understand it, the Healthy Kids Initiative has done a pretty good job setting up a number of advisory boards, including a scientific board, a community board, and an internal records funding board. And as you approach the end of what you might call phase one of the Healthy Kids Initiative, I think it's an opportunity to step back and review what you've done with the boards and what the boards have done with you. And I think you could maybe capture some key learnings about the work of the boards and share their stories. I would also like to consider the idea that maybe you could expand your advisory board infrastructure to include something that I'll call a youth council. This isn't my idea, and I sure wish it was, because I think it's a good one, but I got the idea from Kim Fortunato at Campbell's. And at Campbell's, they just announced, I guess a couple of days ago, a new program called Full Futures. And this is a school nutrition extensive community engagement partnership that will reach over 7,000 students in the Camden area in the next year alone. And the idea behind a youth council is you take these students from middle and high school groups and you use them as a sounding board to ensure that the students' needs, tastes, and preferences are considered and incorporated into your thinking. So it's a way to directly go in and talk to these students. A unique feature of the Campbell's program is that this youth council is actually going to be given a small budget, and the students have an opportunity to run RFPs and to even grant awards. So I think this is a really interesting way to use a board, which is to incorporate, listening directly to the students and giving them a role in the community. So it just would end with advisory boards can be really valuable and a tremendous asset to your program. So I encourage you to work them really hard. The board members want to be helpful. So actively engage with them, and I think you'll find that they'll really help you move ahead in the days ahead.
Thank you, Peter. Very, very helpful advice and very much on point. We're open for discussion from other panel members from a systems viewpoint, what the kind of best advice you might give us for program development or design. I can call on people or let you jump in, or otherwise I will call on people. Go ahead. I see a couple people sort of. Brian, did you want to say something?
Well, Carrie got off of mute first. So
oh, I'm sorry, Carrie, I missed you. I was looking on the other side. Carrie,
No,
you first. Carrie, you first.
Okay,
Please.
sure, no problem. Thank you, Dr. Gillies. I appreciate your explanation and your conversation about advisory boards. It brings me to my thought process on a micro level when I first started out teaching nutrition in the elementary schools in Newark. And this was brought up in several of the comments and chats and presentations earlier about school meals and, what to do when you're educating students and the school meals are not up to par or to the likability of the students. And so at that, boots on the ground level, before we really expanded our programming kind of across the state of New Jersey, it was about these nutrition advisory councils. So not the, professional advisories that you're speaking of, but the kids who really, they're the ones that are eating these school meals on a day-to-day basis. But having their input really helped us to support change. I couldn't go in there as a dietitian and say, you need to change these things. But we could go in there and say, these are the results of the surveys. This is what the Student Nutrition Advisory Council has spoken about. No one is eating, for example, they were a burger. No one is eating this particular food. But what other choices can they have substituting it? And so those changes were made. And now from a more expansive point of view with the Kids Fit program, which is a nutrition education program that's now expanded to more of a train the trainer model. So where our dietitians are not in person, we're training teachers on the program. We're also able to affect and help the school's wellness policy, which these nutrition advisory councils really need to be a really crucial point of a district wellness policy, so that we're still hearing information back from parents, from students who are eating the food. So when we think about like a food security aspect, we need to ensure that these kids are consuming these meals, that the government now has expanded the school meal program, which is wonderful and great, but we need to continue to ensure that they are actually consuming these. And so, another way, just another point from program design and development and other ways to encourage success of that is really that community input, right? Getting their input from it, partnerships on this. So we are still actually in the process of looking to help Newark Public Schools change and advance their wellness policy across the district. This actually, a lot of movement happened before COVID. So we're just in the process of getting things moving on the ground again with this. Was our partnerships, right? We had a partnership with the American Heart Association, with United Way, obviously with Rutgers, and the New Jersey Healthy Kids Initiative has endorsed and supported our Kids program. So these partnerships have also really helped to kind of launch and propel some of these, childhood wellness initiatives inside the school. Thank you.
Terrific, thanks. Yes, go ahead, Brian.
Thank you. Peter, to go back just for a moment to Peter, actually, interestingly, one of the largest concerns expressed in one of our southern counties when we were losing our FCHS educator to retirement was, Peter, the continuation of a program called Grandparents Caring for Grandchildren. There were parents that were displaced either through the legal system or unfortunately through opioid or other addictions. So various needs for helping grandparents to attend to the little ones was really a strong interest of that program. Dr. Rabson, thank you for this question in particular. I think this is central to so much. My view is I'm going to actually build on what Dr. Anderson, I believe, said. It is absolutely critical to have partners at the table at the start of a program, and I would even say before the start of a program being conceptualized. I think having different folks around the table to look at a complex problem from different disciplines or different perspectives only leads to a better conceptualized and a better developed plan of work, better defined research questions, engagement strategies, and quite even, the clarity on who the intended audiences are. And again, from a cooperative extension perspective, this is how we do business. We start with a community needs assessment. And I think it takes humility. I think it requires sometimes subordinating what one thinks or brings to the table with prior expectations and really truly listening to see what some of the needs are. So I think having partners that represent the communities that are in need is essential. Just to build on that, a few other thoughts that I scratched down. I also think, and I think we'll talk about kind of this same discussion from a funding perspective, but I think leveraging relationships across partners, it's sort of a snowballing effect. You can bring people to the table, they bring their networks to the table, and I think you can get a more robust view of what the issues are. I also think it's an opportunity to ground truth assumptions. I think there's been so many cases where you go in with a preconception of what the issues are, and really you're looking at something at a superficial level until you start engaging partners, many of whom I'm really enjoying listening to today, for example, that really have the boots on the ground, so to speak, perspective of what the needs really are. I had one other point, if you'll allow me just a moment to collect my thoughts. And I'm just somebody who inherently believes in the value of collaboration. There's so much good intent and well-meaning effort that is sometimes just simply never going to realize its full potential because all of us as partners, from a state university to a local nonprofit, we need to work in ways that complement one another. We don't have the bandwidth to compete with each other. It only offers, I think, fragmented and partial approaches to resolving some of these issues. And lastly, I would say, look for the non-conventional partner. I actually have listened to today with a lot of interest about some of the challenges in our food system. And for somebody who's worked in agriculture most of my career, New Jersey is not industrial agriculture, which really doesn't have a specific definition, but it has a connotation what that means. Well more than 90–95% of our farms are small family farms. And quite frankly, what I find in the agricultural community is they tend to be very civically engaged. I think of Rutgers Against Hunger, which many of us on this call know about. I would posit that its origins actually had their roots, no pun intended, on an East Brunswick farm when we had a Farmers Against Hunger program and a gleaning program for some of our Rutgers colleagues. And that's a gleaning program where farmers invite volunteers to come out, pick food that is donated and basically consumed that evening. It's distributed into the local emergency feeding systems. So again, I really think looking at partners a little bit creatively is important. I have other thoughts I'll share later on funding strategies, but thank you.
Thanks very much. Ms. Fallon Dixon, you've done a lot with partnering, I know.
We do, we do. And to echo what Dr. Schilling just said, really being kind of not necessarily focusing on, or I guess what I'm trying to say is being more creative about where we look, what partners can bring to the table, especially when we're looking at community level partners. Really kind of getting them to be creative about what assets they have, who within their organization and what their skill sets are. When we talk about things like skills-based volunteerism, is a huge initiative for us to get a lot of our programming off the ground. But again, just being really creative about that with partnerships. and so, you know, not focusing so much on those traditionals, what is everyone bringing to the table on paper, you know, that formal level of communication. When we work down to more informal and gaining information from our partners in just casual conversations, here at NJHKI, we have a greenhouse, we have a hydroponic greenhouse. Over the course of a year, we can grow 5,000 pounds of produce here, and you know that goes to fuel our food access programming's food pantry. We have a farmers market that targets all of our food assistance programs used in the community. So one thing that we learned from our community partners in that phase was a lot of maybe produce that we weren't anticipating growing. So one thing that we grow really regularly now is Caribbean callaloo. It's something that the community has asked for. So just not necessarily something that came certainly from any sort of formal survey on what do you want us to grow in the greenhouse, but just something that came from our partners, you know, and communicating with our community. So I guess the importance of focusing on that informal communication and how that can also impact programs and your work.
Thank you very much. I'm actually going to, the word put you on the spot would be the wrong word, but for Molly and for Carrie, clearly healthcare systems are very important now in sort of overall driving healthcare and health promotion, and really the government has sort of it made that happen by changes in laws, et cetera. And you both have worked very successfully with, you know, a large healthcare system that we are partnering with in terms of sort of carrying this out on the ground. But I'm just curious your impressions about, you know, in the coming years, the value and role that healthcare systems, you know, both the one that you're involved with and others across the country might play in helping foster child health in these ways and child nutrition.
Absolutely. So I think the importance of social impact and community investment and social determinants of health in general are not just buzzwords. They're really becoming the foundation and the culture of healthcare. You know, one thing that I think we always talked about, you know, in years past was moving from from sick care to actual healthcare and kind of moving in that with prevention in mind. And now through the pandemic, there are really dollars to back that up. And so I do think it's certainly a direction that we're taking and a shift that we're going to see really down to the cultural level of organizations, not just something that they're doing on paper to check boxes anymore. It's becoming really, really ingrained in the culture of the organization.
Yeah, absolutely. I'd just like to add that, you know, Molly and I've been working for Newark Beth Israel Medical Center 11 and a half years now, so for quite some time. And the reason I've been there for so long as a dietitian is because of all the programs that Molly has spoke about. We're kind of like right hand and left hand, Molly and I, so we talk about different programs, but we really, you know, we work really closely on all of these things. And if I could say, you know, it's quite amazing that, you know, our hospital has a greenhouse and our wellness center, and we started out with one of the initial programs that Newark Beth started was the Kids Fit program, right now that is now across New Jersey, but it really started as a very local, inside the hospital, addressing childhood obesity in a treatment way. So children were coming in who were already overweight and obese and had comorbidities such as high cholesterol, diabetes, you know, big people problems in little bodies. And that program has had significant amount of success to where our boss, Barbara Mintz, the AVP of Healthy Living and Community Engagement across the Barnabas Health System, had the idea to do a preventative program, right? And to take that and see how we could implement it inside the schools taught by registered dietitians. And so, you know, that had happened for a number of years. Then we realized, as much of the research shows, that kids need to taste fruits and vegetables in order to make that behavior change. So it was a urban garden on the side of, you know, Lyons Avenue in the city of Newark, in the South Ward of Newark, that was connecting to the community, supporting our Kids Fit programming, enabling them to taste these fruits and vegetables, and really, you know, fostering that behavior change that we're seeking. And then it translated into the greenhouse and our wellness center. So a lot of these, we're really blessed to be boots on the ground with a lot of these programs, but from a health system standpoint, because they were successful, now that they really have the opportunity to implement them across the healthcare system and see what other hospitals are going to be, with the Kids Fit programming, implementing those in other hospitals, seeing what worked for us. And that all of that underneath the social determinants of health department, for so to speak, in the corporate level, is really working to figure out what those community needs are in Jersey City and in Monmouth Medical Center, and what their specific community needs are. But taking kind of a look at some of the work that we're doing, addressing all of these preventative health issues surrounding food and nutrition, education and access, and how we can work to spread that across. So like Molly said, the hospital is now, kind of breaking down those walls. We're not just sick care, we're well care, right? That ounce of prevention is worth a pound of cure, so to speak. So a lot of good things happening and under the way.
That was very helpful. It's actually interesting that it seems to be an area where different otherwise competing healthcare systems might actually be able to collaborate to cross geographic areas, et cetera. So very well put. And I want to sort of transition the last sort of piece that you were mentioning, Carrie, was talking about, potential area questions that were arising, research areas, as it were. Will transition us to the third question, which is sort of from this more systems viewpoint as well as on the ground. What are some of the pressing research questions that come to mind as you implement the different programs that you each are involved with or have been involved with, and how might that we might be thinking of in NJHKI as we sort of shift into the next phase? What kinds of important research questions are you seeing? So I'll open it up. Anyone who wants to say anything. And it doesn't have to be, well thought out research plans. We're just saying here, this is just as you said, Carrie, we're seeing areas where there are questions that would be good to answer, coming up, things that would be worth understanding better.
Good. Go ahead, Peter, Dr. Gillies.
Yeah, I have a bit of a question. So I'm going to give Dan this, I'm going to toss this your way, Dan, but I'll talk about the question and then give your thought. I know that one of the symposia that the Healthy Kids Initiative ran was all about big data and information. And I was just wondering, is there anything that came out of that symposia that addresses the question you have here? What are the research questions, or what I would ask, what are the new and unfolding research tools that might be really valuable to move the program forward?
I can't really answer in terms of what the Big Data Symposium offered, but I would say what we're really looking at is we now have an infrastructure where we have contacts with health systems and schools. I do recall one of the speakers who was from Ohio, I believe, I can't remember his name. He talked about the complexity of working with one county database. And if you heard the amount of work that went into just working with one county, he said scaling that up to work with the entire state would be another 3 or 4 years. So when we talk about big data, it's not as simple as say, okay, we have access to RWJ Barnabas, so we're going to pull from that. I think it's a matter of defining what we want to get out of those big data sets and the ethical consideration, especially when we're talking to the schools. So I think there are a lot of options that, the symposium really highlighted. The difficult thing is how do you actually implement a lot of that? One, you need sufficient funding. So we would have to figure out how within the framework that we have, can we get that funding, or is it possible to obtain the funding and then do the second part? So I think it's worth considering. I think we're just kind of put off right now with the logistical constraints.
So other thoughts about research questions and areas that you've encountered or just questions that you'd like to see answered. You don't have to phrase them as research per se, but questions that would be helpful to understand better problems that have arisen.
Since you're accepting kind of poorly formed questions, I'll offer one.
Absolutely.
So one of the things that's really struck me over the course of the pandemic is, and again, I'm going to kind of put this in the agricultural arena. I saw a remarkable level of adaptability during COVID when people were fearful about going to supermarkets or crowded places, where a number of our produce primarily, but a number of our farms really pivoted into direct marketing in new ways, ways that allowed them to offer product in a safer environment, outdoors, in a more socially distanced manner and so forth. So I really have a lot of respect for the adaptability of the industry, but there's a conundrum. We have this paradox, you have these two unequivocal realities. We have persistent and alarmingly growing in some areas, food insecurity. At the same time, over the last 2 weeks down in South Jersey, in the part of commercial vegetable production, we've had beautiful produce crops plowed into the ground. How do you reconcile those two things? You know, one of my colleagues brought in green and red lettuce that her husband on the farm was about to plow in. Gorgeous produce, nutrient-dense foods. So I think some of the questions here, we know what the issues are. We have gaps in our supply chain. Peter, I think that's, or pardon me if I forget who to attribute that to correctly, but some of these supply chains. So I think it's important to understand, you know, the economic, the logistic, the policy realities that are either contributing or maybe partially contributing to some of these perverse realities. That's number one. And I'll just repeat, Dr. Rabson, what I said earlier. I think, and I'm going to comment on this later, but I think what Dr. Cook was talking about earlier is very important about what education is. It's not simply conveying information. So I think understanding the nature of influences that either advance or slow adoption of these types of behavioral changes, especially from a food nutrition perspective, that we know to be good for young people. But again, the influences that are either contributing to or detracting from their ability to make some of these smart food decisions, as well as some of the interventions that might be proven to be successful or less so. But I really wanted to bring up the supply chain issue. I think it was you, Peter, brought that up. I think that's a very important one.
I'll add to that, or take off of that farming thought there. So something that we experience with our farmers market here and across the state and across the country, there are low redemption rates of certain food assistance programming, including SNAP, WIC, and senior vouchers. Obviously, today we'll focus on SNAP and WIC for our young families, and it's something that we see at our farmers market as well. We happen to be fortunate in that we're a hydroponic greenhouse, so we grow year round. We're able to accept, so we operate our farmers market year round, whereas the typical New Jersey farmers market is closing September, October. So we're really able to make sure, if you're familiar with the WIC program, they're able to use those specialty farmers market vouchers through the end of November. So we're able to be a redemption site for that. But every single year we get people coming, oh great, you're still open, I've had all these coupons, I haven't known what to do with them, I don't know where to use them. It happens every year. And then we get those poor people that we see the first week of December, we still have these, can we use them? And they expired in November. Totally anecdotal, but we do know that there are hundreds of thousands of dollars left on the table at the end of every season. And now so much more money because of the pandemic has been filtered into these programs, and there's just more money out there. But has anything been done to address the redemption of those programs? And just curious to see if there's been, I know this is a huge initiative for the New Jersey Food Democracy Collaborative. So hopefully some headway will be made there. But just to see, as more of these dollars have actually, flowed into the system, has it really done anything from a percentage standpoint, or are we finding still the same percentage dollars left on the table at the end of the year?
I think that's a very helpful point. And it's interesting, Peggy had talked about working with Wholesome Wave and some of the vouchers, and there may be ways to get at some data around those vouchers, which is like, it's a different system of available, vouchers, et cetera. But there may be ways of getting at some of that data and ways of thinking ahead at how to understand better what drives people's choices in those regards. Anything else? Shall we move on? We'll move on to the fourth question, which is that NJHKI has collaborated with multiple different organizations in the community, health and educational partners, both with respect to any experiences you've had from your organizations, which is a little limited in this panel, but more generally, we've talked some today about how to enhance collaborations from an academic partnership with community partners, and then also with sort of system-wide partners or with state partners as well. Brian, I know you've worked a lot you work with the state partners actively. Are there things that we should know moving forward or should be thinking about how to collaborate better and really be able to pull in different partners and effectively interact? So go ahead, Brian, I see your hand up.
Thank you. So I'll look forward. I am passionate about bringing the capacity of the experiment station to greater use. We have statewide capacity. We have 1,200 acres of research farms across the state. We have business incubators. We have facilities that are down at the coastal regions. And as we're investing in these facilities, we have three signature priorities. One is really looking at the future of food and agriculture in the state of New Jersey. The second is personal health and wellness with a health equity lens. And the third is climate adaptation, mitigation, and resilience. The three of these are by no means close to being mutually exclusive. In fact, they probably intersect in many more ways than they don't. So one of the things that I think is a real opportunity, and I'll go so far as to say an obligation, is for us at the experiment station, and for those who might not make the connection, Rutgers Cooperative Extension and our research programs live under the auspices of the New Jersey Ag Experiment Station. It's effectively a sister institution to the School of Environmental and Biological Sciences. So we have remarkable expertise capacity in food science. Kara Cute is here from human ecology. Of course, nutritional sciences. We have programs like SNAP-Ed and FNEP. We also have a 4-H program that engages annually 35 to 36,000 youth from across the state from the grades of K through 13, 13 being effectively a year out of high school. So the vision here is a simple one, to actually get greater engagement of experienced, hands-on based activities at our farms and our field stations. And I build that comment off of what Dr. Cook said earlier, and I'll paraphrase, but what I heard in her comments is that education is more than just conveying information, right? So I think what you need is hands-on and experiential gardening. You can read about it, you can talk about it, or you can do it. You can have kids, and we've seen this through nonprofit partners like Learning Through Gardening or Farmers Against Hunger, where when kids touch something that they grew that they would never eat if mom or dad put it on their dinner plate, they're going to eat it. I also think that, so I think demonstration and hands-on is very important, and I really would like to see that greater expanded use of our farms and our research facilities, number one. Also, I think we as a university under duress of COVID found new ways of engaging people. And I think there's a lot of talk about using hybrid and remote technologies to reach greater numbers of people. I think there's truth in that, but I also think it makes the programming of the university inaccessible to people that lack the technology access and so forth. So here too, I really feel strongly about having the infrastructure of the experiment station, including our 20 county offices, more open for these types of community engagement projects.
It's a tremendous contribution. I think very important to really open up the vision of NJHKI in this way. The potential is sort of mind-blowingly vast, far beyond the small staff that we have, but perhaps there are things we can do together to grow staff together in ways that can really make this happen. I can see all kinds of partnerships that would be very exciting. Thank you. Other thoughts and comments about collaborating and partnering? Carrie, I see your.
Yeah, so thank you so much, Dr. Schilling. I wanted to respond to your experience and talk about farming and agriculture. You know, I speak a lot about my personal experience. It's kind of my personality here, but I come from a family of farmers. So my parents currently have a garden center. And when COVID hit initially, obviously what many businesses were dealing with was a ton of fear and how do we proceed and how do we move forward and do we keep our doors open and do we close them? And, you know, coming from a daughter, I was like, no, shut everything down, don't do anything. But thankfully, since the business is primarily outside, you know, we're talking in May being the high season, April, May, early June being the prime growing season. They did keep their doors open, and you may have experienced this in some aspect, but like maybe it's just for suburbia more so, but the growing aspect of people growing their own gardens skyrocketed. So many more people were home. So they started to grow their own food. I mean, I have several close friends and family that are just from a couple different aspects. They were home. The aspect of growing their own food, so they would have an additional resource, the stress relief of growing their own. So this kind of talks a little bit on this question, but also the previous research question. Are there opportunities to research and see how that impacted families and who grow their own, and do they intend to continue doing that? And perhaps that effect could then, you know, affect their community on a larger scale. Now you've got more families and communities that are growing. Maybe they could impact their school communities and churches and their schools, so to speak. Maybe it's a place in terms of partnership and collaboration for New Jersey Healthy Kids Initiative. Maybe garden centers are a place of collaboration. Maybe it's another spot that we would want to educate. I can tell you as a dietitian, I've thought many times historically, coming with my father, having a garden center, how cool it would be to educate people in that space. Of course, I didn't have enough time for it. I got a full-time job. I have kids. That I wouldn't have the time to do something like that on an individual level. But that, just thinking about that potential area for collaboration because of the effect of COVID and how much we really have increased the interest in growing our own gardens.
I think that's a marvelous set of ideas, and thank you for adding that. I could easily see that we have our culinary literacy kits, and we could also have seeds and trowels and sort of a growing kit as well, in a sense. It'd be a different way of looking at things. It'd be interesting to see. I'm going to actually use that as a segue into the last question, which has to do with advice offering around potential for larger funding opportunities, because I'm envisioning we've been pitching culinary kits to the USDA. Maybe it's a culinary kit along with seeds and a farming kit first, so we have a transition. I'm being a little facetious, but not completely, but that provides a transition to thinking about ways that one funds these sorts of initiatives. We've talked about collaborations, but are there any sorts of thought processes around funding, moving forward with longer term sort of funding and kinds of ways to bring new projects on board as really a last topic of discussion, though by no means the least important. So any thoughts that any of you have will be appreciated.
I'd like to offer some stories about fundraising, if I may. It wouldn't come as a surprise to anybody in this crowd that fundraising is really, really hard work. And it just got even harder with the advent of COVID. You know, there's no way to have that personal touch. You know, I used to enjoy the dinners. I used to like the meetings. There was a social side to fundraising that was actually fun. And we've lost that. So I think fundraising is going to be really challenging going forward. That being said, I think we should celebrate how successful the New Jersey Healthy Kids Initiative has been in its fundraising. And I know not too much is being said about it, but I am aware that they have actually been really, really successful. And I'm sure there's stories yet to be told about these successes, but I just want to say that took a lot of work on the part of the Healthy Kids Initiative team to actually pull that off. Now the trick is, what are you going to do now? How are you going to move forward with your fundraising? And here I have a couple ideas. And the first thing I would like to offer is that I think we need, or you need to strike a balance in the types of fundraising that you're doing. And there's that fundraising that's project oriented. And I think that's the domain of grants, government funding institutions, sponsorships from corporate entities and philanthropies. I think that's one part of the story, and I think you've been very successful there. Another part of the story has to do with endowment-based funding. And I think that's the key to the long-term sustainability of initiatives and programs. Endowment funding is about legacy. It's about really altruistic philanthropy. That's a lot harder to get at. It's a really big, heavy lift. And I recognize that. Fortunately, you have as a resource the Rutgers University Foundation. And I don't know to what extent you've been able to leverage them to date, but I would encourage you that each and every team make a special effort to help work with the University Foundation. You know, if there's a mantra in real estate, it's location, location, location. Well, the mantra for fundraising is relationship, relationship, relationship. And in that regard, I've got 3 pieces of advice. And the first one is that I think it's really important that you continually share and update your stories with everybody in every possible way feasible. You have no idea when a given story will resonate and capture the attention and maybe the purse strings of somebody out there. So you really need to make a special effort. And only you as team members and participants in the program, only you have the detail to tell a really resonating story. So collect your stories and make sure that you get them to the hands of the Rutgers University Foundation to help them spread the word. And I think you will, I'm convinced that you will be successful. You're engaging people, people are going to respond to you well. Second piece of advice would be that when you're approaching potential funders, I think you should be approaching them just as often for advice and counsel as you are approaching them for money. They need to feel valued. But if you ask them for advice and counsel and ideas, you know, it might surface new opportunities that you can work with going forward. And finally, I would encourage each of you to adopt a very long view and remember that you're at the beginning of a program and you're building for the future. And that you have, it's really important that you have a long and enduring impact in society. And the way to do that would be to build the endowment side of it so that you have sustainability. And I'm going to tell you one quick story just to put this into practice. And I'm going to give this story as a shout out to Jonathan Pearson. So here I am, I'm at the Institute, and the University Foundation says, Peter, you ought to go see Jonathan Pearson. I'm going, who's Jonathan Pearson? Well, Jonathan Pearson is the director of Horizons Foundation. So at that point in the relationship, Jonathan Pearson was a position. He was the director of the program. So I went up to Newark and met Jonathan in his office. And a really terrific transition took place. He went from Jonathan Pearson, the person, the director, to Jonathan Pearson, the father, the coach. He was into athletics. He was into nutrition. He was into healthy kids. From that point on, my relationship with Jonathan became very personal. And I think that's a key part of the relationship. You have to get there. You can't be, I'm representing such and such. You have to say, I'm Peter, you're Jonathan. Wow, this is common ground. So you need to find that common ground through the personal relationship. And then you have to do something with that. That's just a starting point. And what we, and as Jonathan and I finally realized would be useful is, we invited Jonathan to be a member of the External Advisory Board. We gave him a position, we gave him something to do, and he wanted to do it. And he brought in an interesting perspective. And so he worked as on our advisory board. And after all of that, at one point, there was this aha moment. And he said, our foundation might be interested in funding this work that you've got with young kids, young athletes, and human nutrition. And where are you now? The Horizon Foundation is probably your stakeholder investor in the New Jersey Healthy Kids Initiative. So with time and effort and work and personalized relationships, I think you will be very successful in raising even more and more money.
Thank you very much, Peter. That was tremendously appreciated. So well thought out, so informed, and just very meaningful, and I think very productive in the long term. I'll open up to any other panel members or anyone else for any comments about this.
Hi, everyone. I would just like to say thank you so much, Dr. Gillies, for that, for all of your advice. When I saw this, this question, when you raised this question for panelists, I'm thinking, okay, how can I provide advice for other grant seekers? We are always looking for grants to support our programming and applying for new grants to advance what we're doing. So I really appreciate your thoughts on that. And some things that we could definitely do better as our organization in terms of asking for advice from the council, from funders, and strengthening those relationships. And many times, we're asked from funders for a lot of our programs for data, for presentations, and it's really only the communication is when they come to us and ask. And so perhaps now that you've offered that advice, I'm thinking we need to reach out to them more often. When some of those personal stories come up, reach out and share them, not just when our grant or half year point is due and we have to send our reports in and we need some of all of this outcomes and feedback. Because the research is certainly important, the outcomes of the grant is essential, but those personal stories is really what connects someone and kind of drives them forward and interested in funding programs. So thank you for that. I just wanted to add from my perspective with our Kids Fit program and what has helped us to gain some funding for us and perhaps some advice for other looking for funding is that I think the organization needs to have some skin in the game. So you're not looking for 100% of the funding, that organization is already inputting significant dollars into the programs, and all of our programs are all partially funded by our organizations as we look to have that. So skin in the game, I think, is key. Sustainability, we have a lot of wonderful programs. And as I mentioned early on, a lot of the work we started as boots on the ground and just a single program, but where are we going, in terms of how can we expand it? How can we sustain this? There's not a constant flowing of influx of money going into these programs. So what is your sustainability plans for the future? And I think the other piece that I've noticed a lot of recent grants that have come up, a lot of them have been looking for policy change. So I think that that's another thing to think about is how we I think programs are still really, really crucial. And I don't think that from a dietitian standpoint, we can ever get away from figuring out what we're doing actually on the ground, whether it's us personally or the programs that we're creating. But what else do we need to do from a policy standpoint to keep these programs really active? So I spoke a little bit earlier, and I won't, repeat all of that, but just with the Kids Fit program, the education piece, but also the wellness policy piece for, a district, different districts in New Jersey for schools. So thank you.
Fantastic. Anything else to add? Go ahead,
Dr. Robson, this will be very brief because I think, I'll just let Peter's wisdom and words kind of move around people's minds. Peter, it's all about relationships. It's about belief. And I think the only thing I would add to that is you're trying to make that connection. You're trying to build that belief that what we're going to do is meaningful and impactful, and we'll do what we say, and it's going to have the intended impacts. So the only thing I will say is part of building that personal connection is, I believe, having the range of partners at the table, again, so people can see how we're engaging the communities that we're seeking to serve, that we're really immersed in the issue. We understand the issue. We have the intended beneficiaries there to help us convey the importance of it. But Peter, your words were beautiful in their simplicity, spot on, and I echo everything you say.
Thank you. Any other comments? This might be the right place to wrap up this panel. I think this is extremely useful. I think this panel provided us with from my perspective, exactly with the kind of thoughts, feedback, perspectives, advice, vision of the future that will be so helpful to us. And I'm sure to everyone who's listening with respect to their own activities, academic, community-based, etc. So I thank the four of you, Brian, Molly, Carrie, and Peter, so much for your thoughtfulness and really bringing such sincerity, insight, and really heart to this panel. So thank you all. And with that, I'm going to provide a few remarks to sort of close the day. The first thing will be sort of logistical, and Chris has asked me to remind you that you'll all be receiving feedback surveys for today's symposium by email very soon. And we'd really greatly appreciate it if you could take a few minutes, and they're short, to complete these surveys so they'll help our program improve and grow. So we're deeply appreciative if you would take a few moments to do that. Before I sort of make the final sort of closing summative, as it were, remarks, the most important things I have to do is to give thanks to a number of people. First of all, to those who made this day possible, and this really, I think, it's very successful, exciting, enjoyable symposium possible. So I specifically want to thank the NJHKI team for their work today, and most importantly, Chris Gunning, who saw the big picture and he paid attention to every detail as well of today's event. And Chris, your work was just stunning, and we're all grateful to you and to all the members of the team, including Mara Damodar, who really put together our previous symposium and helped us start to think about this before she moved on to her next endeavors. So thanks again. Most importantly, in closing, we want to thank from the bottom of our heart the people of the Robert Wood Johnson Foundation for their vision and foresight, working initially with Dr. Gillies and with me as the early concepts began to emerge, and then with Dr. Hoffman and me, and also with important contributions of Dr. Dominguez-Bello, David Kroll, and the whole team to bring NJHKI into existence and into fruition. We owe special thanks to Kathy Malone, who's been our guiding star of wisdom, of practicality and support, and her staff and others at RWJF, including Susan Haluka, who really has helped sort of with the budget piece and made our work possible. And in that regard, Roger Grillo on our side as well, who really makes sure that we work effectively. And we want to thank all of you, everyone who's attended today, all of our supporters, partners in the community, and those who've attended this event and any previous symposia as well. We really want to continue. This is the summative part of our phase one, but we want to stay in touch with you. You're a part of the family, and we all depend on each other to make these activities happen. So just to close in terms of today, I think we've really been privileged to hear from experts at the cutting edges of different facets of child health and nutrition today, from the ethical aspects of what we as a society should and must do, to the whys and hows of nutrition education and where it can go, and to the ways in which we as individuals and units of social systems can engage families, schools, communities to promote a culture of health for our children. And optimal weight and nutrition is a focal point and an exemplar of what we can do in particular, an area of commonality in our polarized society. And through our panel discussions, both this morning and now, we've seen examples of successes in our own communities, approaches that work and don't work, and we begin pointers for future focus and development, reflecting the perspectives of all of you, of families, educators, academics, health systems, governmental and social structures. And we've heard of our own activities, the development and successes of small and then larger and larger steps of progress here at Rutgers through the efforts of NJHKI on the ground, in schools and communities, and in developing paradigms and infrastructure for a growing research agenda within IFNH, Child Health Institute, and the Rutgers communities. As Chris actually said yesterday when we were at our get-together, from this summit of this symposia, as it were, we've had the opportunity to look back at how far we've come, but more importantly, to look ahead at our future, to the next phase of NJHKI. And we've heard the challenges issued to us to expand our community impact and our research contributions. And particularly, we've heard today over and over the challenges of COVID, of balancing the fundamental paradox, as you put it, Brian, of food insecurity at the same time as overabundance and overnutrition, over obesity, et cetera, and how to balance these, but mostly the sort of seismic shift that COVID really has imposed on our society. So in closing, I'm asking all of us to take time to consider these challenges over the coming days, months, years, as we individually in our own workplaces and lives best respond to these challenges. How can we best respond and foster a lifetime and culture of health for our children here in New Jersey and beyond? So with deep gratitude, I wish you all a wonderful weekend and a health and safety as we move towards the end of the year and the holidays. And we bring the meeting to a close without any further comments. Thank you all.